very important workshop that we've been able to organize with some expert content that we think you're all going to enjoy immensely. And also it's going to provide quite a lot of insight, we believe, that isn't available otherwise right now as we plan for the future forward. So with that, we're just going to do one last audio check before we get going to stick on time. And Lana, I'm going to make sure that we are broadcasting live and clear and that you can hear me and I can hear you.
Yes, we're live.
Very good. Okay, fantastic. So everybody should be able to see if you are an attendee here today. We've got several of our presenters joining us. Their video is more or less turned on, as is our team at CUTRIC. And with that, we're going to get started. So I'll ask you if you can move to the next slide. So just by way of introduction and presentation, first going to start off, I'm Josipa Petrinic. I'm the President and CEO of the Canadian Urban Transit Research and Innovation Consortium. And I have on the line with me my colleague, Jason Lesage. Jason, I'm going to ask you to introduce yourself quickly.
Yes, good morning, everyone. Good afternoon, wherever you are. My name is Jason Lesage. I'm the British Columbia Liaison Officer based in Vancouver, British Columbia, Canada for CUTRIC.
Fantastic. Thanks so much, Jason. And we've got a series of my colleagues on the line, Landis Anderson joining us from Lethbridge, Alberta, and Grace Riley joining us from Toronto, Ontario. With that, we're going to start off with a quick introduction to the reason why we're running this particular workshop, and then we're going to move into the content right off the bat. As a bit of introductory intellectual, or rather IT support, if you take a look at your Zoom platform, many of you are familiar with this platform as it stands, there is a Q&A function. We will be taking questions throughout the workshop. Each speaker is lined up to answer questions at the end of their presentation, and we have a plenary Q&A section at the end of the workshop overall. So please do use that Q&A function if you have any questions. You can also use the chat function if you have any technical issues, are having difficulty seeing the screen, or any other issues that our team can help you out with during the presentation today. So just to start things off, I'm going to ask you to go to the next slide. As an overview, for those of you who are unfamiliar with CUTRIC, we know we have over 200 people joining us today. And so as a little introduction, CUTRIC is an innovation consortium in Canada. We focus on low carbon smart mobility technology. So we work with the transit industry, we're a nonprofit, but all that we do is technology innovation. So we're not a general transit association. There are lots of those and they're very good, APTA and OPTA and CUTA and ATUC, and they do the work for the transit associations. What we do is technology innovation with transit as a partner. And so everything we do focuses on low carbon smart mobility. If we move to the next slide, you'll see that at CUTRIC, we have 4 pillars of innovation. All of our projects, whether they're prototype projects, demonstration, integration projects, data analytics projects, they fall in 4 categories. So zero emissions, low carbon propulsion systems, smart autonomous shuttles for first kilometer, last kilometer, big data for mobility analytics, and cybersecurity in advanced mobility applications. All of our projects fall in these 4 pillars. If you take a look at the next slide, we do look at membership services, research and consulting, commercialization services. So we're a full suite nonprofit that looks to create jobs and innovate low carbon smart mobility across Canada. And we've launched several major projects like a Pan-Canadian electric bus demonstration and integration project around standardized busing. That's the type of thing we do. So you might wonder why we're getting involved in a COVID dialogue. Well, the reason is because social innovation and policy innovation constitute innovation. Social policy is a form of technology, it's a social technology, and that's why we think it's critical at this stage to highlight the dialogue moving forward in terms of the innovations to the system and systems planning that needs to occur to prepare ourselves for a future forward, which might be even more catastrophic or more devastating if we don't line up our assets in a way that allows us to deploy for emergency purposes. And transit is asset rich, and so that's what we're looking to discuss today. And with that, we turn to the next slide. For those of you who might not be able to stay till the end of the webinar, at the end of the webinar, we will talk to you a little bit more about the conference coming up. In case you cannot stay, for those of you who are registered on the webinar today, our national conference in June, which is fully virtualized and focuses on electric transit and autonomous smart mobility transit, is running from June 17th to 19th. And specifically, if you're on this webinar today, if you use that code webinar5692, you'll be able to access a discount for the early bird rate, which ends ends tomorrow. Thanks very much, Lana. So we'll move to the next slide and we'll move right into the content of today's webinar and workshop. I'm going to set the scene in terms of why we even started looking at this issue at CUTRIC, apart from the fact that we're quite keen on technology innovation. From a social innovation standpoint, we took a look at what was happening about 2 months ago. And the first thought that comes to our mind, since we have a bunch of data junkies on our team, including myself, is history probably has a few lessons for us. And this is no doubt not the first time pandemics have struck. And thus it is certainly not the first time we've had to grapple with, well, what is the role of transit in the case of a catastrophe or a pandemic? And we had already for about 1.5 years been thinking about how does transit plan for the flood of the century, the climate disasters that are already occurring that we know are going to occur at a worse and worse ratio. How does transit react or respond or proactively help to overcome wildfires and massive floods and tornadoes caused by climate issues? That led us to think about, in the case of COVID, what has already happened around the world that could allow for the proactive deployment of transit assets, not the reaction of transit to a circumstance, but a proactive deployment, the same way that states often proactively deployed the military as a tool to use in the case of crises. There is a huge amount of assets, a very large quantity of assets within the transit domain that are probably underutilized as a proactive deployment tool and a set of assets that could really support overcoming critical crises. So first we did brainstorming. We took a look at literature and we took a look at some past examples from Ebola, from Zika, from the Spanish flu, other cases when transit has had to be deployed or public transport has been deployed as a proactive pandemic fighting or catastrophe fighting or disaster fighting tool. And what we were able to do is document the fact that there are definitely some core assets available here that we need to look at in proactive planning. There's buses, coaches, trains, and ferries, which are large, cavernous, mobile spaces. There's service-oriented and organized labor. There's a highly trained and organized and retrainable labor force within the service industry that, here where we're looking at the labor force and certainly labor unions, you have a standing army of people that are service-oriented, community-oriented, already well-trained, and could be retrained and redeployed to be the heroes of the century in cases where we need them to do that kind of work. There's advertising spaces, static, mobile, and digital, and there are control rooms, vehicle and network control rooms for large transit in particular that are possibly able to be re-equipped or utilized in order to asset control in the case of pandemic, extreme event, or catastrophe. So to take you through some of what we found when we took a look at literature and we took a look at case studies around the world and we started hunting for how have people done it elsewhere, and that leading to our creative ideas about how ought we to start thinking about doing it here in Canada, I'll take you through give you a bird's eye view rather of some of the information that we found. So if we go to the next slide, first off, from a communication standpoint, there is transit communication platforms all around us, as many of you are aware. And there is a mechanism, it is entirely foreseeable that there could be a mechanism by which within 24 hours, within 48 hours, within 72 hours, and then over a series of weeks, all of those communications platforms are deployed in order to advertise and communicate not just the response of transit, but proactive public health messaging. So imagine 8, 9, 10 weeks ago, if there had been something like what we use in Canada, an Amber Alert service, which immediately goes to your phone and says, a child is missing and be aware. And that's the Amber Alert service that's been created in Canada to help overcome lost and missing children. A similar service that is pushed out through the digital and physical signage on trains, buses, coaches, ferries, and at stations and stops, push notifications through transit apps, and push notification through the digital fare web platforms. That is a huge amount of public health messaging space. In Canada, that would mean that a federal public health agency coordinate with provincial health agencies to get out standardized messaging about what people need to do, what they shouldn't be afraid of, what they do need to be aware of, how they need to react and respond. That public and provincial health services could work with provincially governed transit agencies at the municipal level to push out information in an Amber Alert style that has a 24-hour, 48 and 72-hour time span, followed by weeks of that advertising. If you go through the subway systems of Toronto today or hop on a bus in Calgary today, it is not the case that public advertising has been completely converted to COVID messaging. And possibly this is a lesson learned that this is the kind of thing that we could do in the future. And we saw some examples of that in terms of using public advertising in Africa during the Ebola crisis. Not widespread, but there were some case studies we were able to find. If we go to the next slide, the next strategic step that we found in the literature was paramedic services, turning coaches and buses, trains and ferries into evacuation tools to evacuate people from active disaster areas, and also to move large quantities of people from infected sites to other sites like hospitals or quarantine sites. So it is entirely feasible to think of transit within a 72-hour period or a multi-week period if the disaster that we're speaking about becomes quite severe, that it is turned into a quasi-paramedic service, either picking up people from their homes, helping to transport medical personnel, transporting sick and ill patients. And there's a lot of literature coming out of, in particular, Ebola, about how you move people, personnel and sick people, how do you move them in a safe fashion using a variety of assets that the public purse has control over. So we'll go to the next slide. Then that segues nicely into the next area, which is using public transit as an emergency and medical personnel transporter. So this means both moving people in a sanitized fashion, doctors and nurses and medical personnel, to facilities and sites, and also possibly, and this is brainstormed at CUTRIC, a concept of medical personnel only concierge transport services. We hear lots of stories about nurses being worried about the fact they're taking transit and walking into hospitals and walking out of hospitals and getting on transit because they need transit. They don't have cars necessarily. And so we have been able, as North America and Europe, to offer seniors only hours at shopping markets. Is it not possible to create nurses only busing services, whether it's within a schedule or on-demand environment, or it's the labeling of buses as medical personnel only, the positive type of segregation we may need to impose in order to protect medical personnel and also get them to where they need to get to help those heroes of a healthcare crisis actually deliver to us the services we all desperately need. So turning transit into personnel movers. If we go to the next slide, this comes out of a lot of experiences, turning cavernous mobile units into command posts. So there's a lot of experience in doing this, loads of case studies around the world, in turning coaches and buses into mobile command posts if in fact the disaster requires it, pandemic or otherwise. If we go to the next slide, then we see that there is some literature around turning public transit assets into mobile testing facilities. And we started brainstorming at CUTRIC the idea of getting buses out to remote First Nations communities or rural communities that don't have intense hospital or medical services. And then you can even envision in intense urban communities like downtown Toronto or Montreal or Vancouver, if you want to prevent clustering at the few testing facilities that are set up, you could set up mobile testing facilities. And theoretically, if you got to a stage where you had like a test that turned around a result in 15 minutes or 20 minutes, you could have also mobile treatment facilities. So testing on site, and then potentially the deployment of these vehicle systems into treatment facilities. And we've all seen these images on the right-hand side of people driving up in South Korea and elsewhere around the world to get tested. Not all of us have cars. I don't have a car. So how do I get to a walk-up testing center? There is no such thing right now. Is it possible to go to a mobile testing center housed on a series of buses in a local parking lot? That is possible to envision, and we would like to start promoting that dialogue. Lastly, we'll go to the last slide here in our 6-point strategy that we've started to develop at CUTRIC, the deceased and casualty transportation. So deploying buses, coaches, trains, and ferries for casualty transport. And this isn't only when there's a tornado or a fire, but we have all seen the pictures, and having the deceased stack up in hospitals and clinics is unsafe for everybody. It's also a bit inhumane, well, quite inhumane to the families in question. So turning transit services into casualty transportation services. Those were some of the several areas that we were able to identify within the literature. And so with that, we're going to turn now to our first presenter. If we go to the next slide, it's Karen Cameron. And so Karen, I'm going to turn over to Jason to introduce you briefly, and we'll start on the next slide, Lana, and we'll turn over to Karen as she is unmuted.
Yes, thank you. Just introduce Karen Cameron. She is the President and CEO of the Ontario Public Transit Association. Over to you, Karen.
Thank you, Jason, and thank you, Josiva and CUTRIC, for the invitation to participate. I just wanted to say Opta is an association that represents over 60 of some of the largest, yet some of the smallest transit systems in Ontario, where we have 111 transit systems across the province. We've been working closely with our members throughout this pandemic as they share their best practices and try to figure out how best to support their communities. Opta has also used CUTRIC in their consulting role as well. So we have a lot of experience with that and appreciate their expertise and appreciate them bringing this workshop to everyone today. For the context currently for Ontario, those 111 transit systems bring in $200 million of revenue every month. And with efforts like rear door boarding to protect the workforce and to protect customers, it's 100% revenue loss right now for transit systems. So these are beyond unprecedented times. For transit to not have access to that revenue has really caused a lot of rethinking of transit from the ground up. And so not only in the context of the pandemic, but it's exposed a lot of other social inequity issues that transit systems are dealing with. And so we're hearing lots of stories of specialized transit services who already have very close relationships with a very vulnerable population of clients, working with their local communities on delivering food and delivering other resources. We hear from other systems in rural Ontario where those systems are being deployed to provide transport to testing facilities. And so the PPE requirements for those operations are much more like a medical operation than strictly a transit operation, and those local communities are doing that. There are also the ongoing kind of classic emergency responses that we see. We're all familiar with seeing in the news an apartment fire, an event going on at a seniors center where those seniors need to be transported. And transit has always been one of those municipal assets that is at the ready. As Josipa already mentioned, the relationship between transit and the military, that militaristic operation of transit is a long-standing feature, and it makes it so easy for transit to be there at a moment's notice. Operational staff are used to responding to both emergencies with no forewarning, as well as these kinds of kind of a pandemic where this is not going to be a short-term thing. I'm sure that everyone if you're a North American, you're not really used to the whole mask issue. Masks are a big deal. I myself am trying out any number of masks as I realize that as we start to reopen our economies, that we are going to be in public spaces where physical distancing is not always possible. And so we're out there working with local health departments and now provincially with health departments to understand what can transit do to ensure that safety. I've already noted, Josipa's suggestion about nurse-only times and those kinds of things. The on-demand responses, lots of systems have been thinking about service integration, had been thinking about on-demand, and many of them just dove in with both feet, both integrating their specialized transit services and their conventional services that are now down 70, 80, 90% in ridership. So doing that first phase of pandemic response, and now looking at what stage 1, 2, and 3 look like for those systems. So I appreciate the invitation. We received a lot of interest from Opta members in this workshop, and we look forward to hearing all of the other case studies that you have presenting today.
Thank you so much, Karen, for that overview of everything transit is facing and what it's going forward with in terms of the future that it has to manage. With that, we're going to turn over to our next speaker. Thanks so much. And we do already have a couple questions. And so we're going to cluster the questions in Haley's Q&A period. We may come back to you, Karen, for a few questions on your end. Over to Jason to introduce our next presenter, who is Haley Liao, Head of International Development.
Yes, just want to say thank you to Holly. She is coming to us live from Shenzhen, China, which I believe it is 10:51 p.m. local time. So a big thank you to Holly for staying up for this. And over to you, Holly.
Great.
Thank you. Hi, Jason. Thanks for the introduction. Hi, everyone. Thank you for inviting us. I think it's a great pleasure of ours to sort of present to you what's happening in China, particularly in Shenzhen. Just sort of a brief introduction on Shenzhen Bus Group and give you a bit of a background context on what's happening here. Next slide, please. Thank you. So, so for those of you who have never been to Shenzhen or has heard of it, it's one of the biggest cities in China with 20 million people. And and for Shenzhen Bus Group, we are the largest public transportation operator in the region. We run the biggest electric fleet in the world. So we run an 100% electric fleet with around 6,000 buses and 5,000 electric taxis in the city. And back to the COVID situation that we were dealing with when it first broke out in the epicenter in China, which is Wuhan. It's around 3 hours plane ride from Shenzhen. And the entire country was effectively in a very strict lockdown from the end of January to March. So we have been in a lockdown for 2 months, and then they slowly opened up the economy from the first week of March till now. So now I would say we are probably 95% back to normal business activities, still nightlives and restaurants, bars, etc. Those are slowly picking up only in the past 2 weeks. So I think I will later also talk a little bit more about the measures that we have taken, but here is just sort of the stats on the COVID infection rate in outside of Wuhan. So I would say most of the cases in China happened in Wuhan, but when they locked down all of the transportation in Wuhan, they were able to control it. So next slide, please. And so for us, we actually saw the ridership decrease by more than 90%. This is the April, but in January, we saw the ridership decrease by more than 90% because of the lockdown. However, we did kept a lot of our lines running for the purpose of transporting medical professionals and delivery services, etc. And if we look at Wuhan, so I understand that whether to close down the public transportation system, a lot of times is the decision of each individual municipal governments, and for us as well. So for the Shenzhen government, they have decided that we would keep 10% of our lines running. And in Wuhan, actually, interestingly, they kept at least 600 buses mobilized every day during the height of the pandemic to transport delivery services because they were under very strict lockdown. No one was allowed to even step outside of their apartment. So actually what happened was that everyone was effectively in a community where there are community service workers that were delivering food, goods, etc. to the door. And obviously those were the amount of the PPE that they had available then. So next slide, please. But this, I've mentioned it earlier. I think we'll skip this part. Give it, next slide. Yeah, and for us, we have sort of implemented, so we had an emergency procurement procedure where we bought a lot of the mask protective gears and disinfectants to equip to all our drivers. And in China, it was mandatory that everyone has to wear a mask when you go out to the public. And that was also encouraged and onto our buses as well. And for our buses, actually we have installed an app on WeChat, which is the payment app that most of the passengers uses in China, where you are encouraged to fill out your info on your phone number and your name. So that is actually in case of where later the authority discovered that someone else that has shared a vehicle with you that were later confirmed to have COVID, then you would be contacted immediately. So actually, it's not a mandatory service. We still have that implemented now, but we do tell everyone that this is for your own safety, and that if you want it to be notified as soon as possible, then you should fill out your info. So yeah, but luckily, I think so far we have not yet discovered any cases that were transmitted in our buses, knock, knock. But yeah, so I think it's quite important this time where we were able to utilize sort of the mobile payment technology, QR code, all of these that are readily available for us to use. And for our buses, we kept it at 50% capacity still, even till this day. So we had to dispatch and utilize more of our buses because our passenger load is capped at 50%. So for a 40-seater bus, which is most of our buses, we only allow 20 people to go on. And but luckily that wasn't too big of an issue in the past few months because we saw such a drastic decline in public transportation ridership where there wasn't too much of an enforcement needed because there were already not enough people that were taking the buses. And actually, so for Shenzhen Bus Group itself, since we are a company that has more than 30,000 employees, including all of the staff, the drivers, etc. We run 50 canteens and cafeterias for our staff. And since January, we have set out all of these canteens to be a single person table. And every department has different time schedules where they go to lunches, breakfast, and dinners. And everyone is encouraged to wear a mask until the moment you start eating, and there's not much chit-chatting happening just to prevent cross-infection. So I think we, even till now, 5 months later, we are still keeping this practice. So I think this is probably going to be the new normal that we're looking at for the foreseeable future. Next slide, please. Yes, and cruise ship. So as the public transport operator in the city, we were actually tasked with a lot of the emergency tasks on transportation during COVID. So this was in January, and we later discovered that among 5,000 passengers on board on one of our cruise ships that departed from Shenzhen to Vietnam, we had 200 people who either came from Wuhan or had contact history with people from Wuhan. So we were given a 12 hours notice because that's when the authority found out sort of the severity of the cases, where we mobilized 70 buses and we trained our drivers and staff into full protective gear, etc. And everyone was put into a 14-day quarantine, meaning the drivers, after they pick up these passengers to the designated quarantine facility, which are the hotels that the government set out for these 150 passengers. So that next slide, please. So that was one of the evacuation that was done quite successfully since none of our staff were infected after. And next slide, please. Yep, and next one. And for those of you who don't know, Shenzhen is also the neighboring special economic zone that borders Hong Kong. So it's actually one of the main gateway that connects Hong Kong International Airport, Hong Kong, the city, and mainland China. So during the second wave of infection that we were seeing from March till now, I think now the situation is getting more under control in Hong Kong, but we were seeing waves of imported cases internationally, etc. So we disinfected all of our buses that were used to transport passengers from checkpoints and to have them to have special arrangements to carry people who were tested at the borders and at the checkpoint to the designated hospital as well. So this will be, I think this measure will be effective in place for at least the foreseeable future, as well as long as the border and the situation, you know, across the world, we are still under effect.
And Haley, just to let you know, you have 4 minutes, and then we'll turn to questions.
Okay. So I think, all right, so just to wrap it up very quickly, I would also just bring up, we have developed a lot of the online courses for our drivers and staff in January, because we had such a large amount of staff that it wasn't safe to train them in person on sort of, you know, how to disinfect, what are the protocols and procedures, that we did it through sort of a package of online courses that was developed internally to carry out these protocols. And we also established sort of a therapist group that were available to all, you know, our staff that were then quarantined in Hubei or in Wuhan, that were for the foreseeable future where they probably were not able to come back to work. Yeah, so I think these are some of the measures that I think were quite effective, and yeah, and so I think I can also answer some of the other questions if
Very
yeah.
good. That's fantastic. Yeah, and I know you had a few more slides you wanted to share with. So we'll, if you want, Haley, we've got quite a few questions we can turn to, if that suits, and that gives us enough time to answer some of the Q&A.
Sure.
So I'll turn to some of the, yeah, that's great. And so I know there's a little bit of a delay in our timing, but hopefully you can hear us clearly. So first question that we're gonna pose is just a general one for both Karen and yourselves. It's actually not a question, it's just a statement from a colleague online, an attendee online who has said, you know, one thing to keep in mind is that the transit has also been used in the past to transport food, and it's been used as a pandemic or a response mechanism to transport food. And in fact, that will come up in a couple of our presentations down the line. But specifically for Haley, now yourself, there is a question here about, are you hearing any concerns from bus operators about their own safety? Are bus passengers willing to ride again? And what are their concerns that Shenzhen Bus Group is hearing specifically?
Okay. So as I said, back in January, I think a lot of our bus drivers, because everyone was in a nationwide lockdown, actually they were not getting, you know, not at all probably enough passengers every day. And in fact, we were running a lot of empty buses on the street a lot of the times, outside of carrying the sort of the essential service personnel. So, and also all our drivers were, it's mandatory that they wear gloves, mask, and everything. And that each of our buses has to be disinfected and clean after each service trip. And all of that is documented on a sheet that is put in front of the bus. So where every passenger, when they board the bus, they actually can see when was the last time that the bus, the seat, etc., is being disinfected. So I think sort of the communication, telling that, you know, the passengers that, you know, we are taking these measures where they can see hand sanitizer, disinfectants, the moment that they walk into a bus. So all of these signals, these messagings are very important for especially for the public to regain trust in public transportation, because, well, let's be real here, it's going to take a while for the general public to be comfortable again to ride freely on public transportation. Even for us, we saw, so when the lockdown ended, we saw the ridership at around 50% of our normal load. And now, 2 months later, we are slowly climbing back to 60, 70% during peak hours, where at normal, you know, it's 200% of the capacity. So we're seeing a lot of traffic for sure. And everyone who has the option would drive. So I think sort of communicating through the channels that you have, and for us, we post on our WeChat, our website, English website, Chinese website, all of the measures that we have taken to ensure, you know, the safety of everyone. So that I think it's very important.
That's great. So I'm going to turn to you, Haley, for a couple rapid fire ones. We've got a few questions, but we've only got a few minutes. So if you could try and answer maybe in 30 seconds, we'll put you under pressure. So first off, from Amr Shalabi, who's a professor at University of Toronto, what control measures do you have in place to ensure buses are in fact running at 50% capacity and people are staying away from each other, rather? Go ahead.
So, different privacy laws, different GDPR rules, etc. I understand that, but in Shenzhen, we have 7 cameras on each buses for safety monitoring. So we have a 27 emergency monitoring room that sort of checks these passenger loads on each. And we actually have extra buses readily available at the nearest depot. So when we see the passenger load pick up and exceeding 50%, then we dispatch another bus right away. So I think it's about having an extra one, yeah.
Oh, so real asset management there. And one of the questions was already answered from Al Pritchard, which is, are you using any type of microbial surface treatments to protect passengers from viruses? And you sort of mentioned that already, but is there anything else you wanted to add about the answer you provided before?
We are looking into different disinfectants and even including like the nanotechnology disinfectants, all of that, where you spray the seed where it could stay coated for, I think, 3 months or so. We are looking at all of these different measures, but so far we're just using the basic ones, yeah.
That's great. And we're going to try and fit in 2 more rapid fire questions. One is from Richard Haparenta, and sorry, Richard, if I mispronounced that, but what has been the public's reaction to the contact tracing application? And how do you see the transit operator playing a role in enriching the acquired data?
So I think the important thing to note here is that unless there is an incident where it connects you to a confirmed case or a likely case, you are actually not, you will actually not get notified, etc. Normally. And actually in the case of China, wherever you go now, so for me, I'm taking a flight tomorrow to Shanghai. And I basically, what I have to do is I get to the airport, I scan a QR code, and the QR code that will show what region you have been to in the last 14 days. So for me, it would be probably Shenzhen, etc. And that will mark sort of like your risk level. But I think people are aware that you need to give the consent where you give your location data, where they cross-check with your mobile service provider where you can go. But effectively, that is a speed, that is a mechanism to set up for you to be able to move freely. So I don't have to get tested at the airport. I don't have to get quarantined once I get to Shanghai, etc. So it's sort of, I think it's sort of a trade-off. You don't have to give the consent to, but you would have to wait longer. And so I think this would just be a choice that people make.
Okay, and we can fit in a couple more rapid fire. 2 questions on mask wearing. Michael Roshlau, former president of the Canadian Urban Transit Association, asked, how do you see mask wearing and reestablishing public confidence in using buses in Shenzhen? Different culture, different jurisdiction. And there was another question about, is it possible to have mask dispensing units in Shenzhen and in your bus service areas, your terminals, about the masks overall?
Yeah, actually about masks. So, obviously, the context in East Asia is that we are a lot more used to wearing masks because we're in such dense cities. I mean, just take Shenzhen as an example. We have 20 million people. So I would not feel very comfortable if no one is wearing masks out in the public right now. So even now, we have not seen any locally transmitted cases in the past 83 days. I would still say 99% of the people I see out in the public are wearing masks every day. So I think it's sort of a norm that we are easing ourselves into now, even though summer is coming, it's very uncomfortable. And we do actually have a lot of extra masks in our taxis and buses. So if there is a passenger that gets on the bus that don't have a mask, the driver actually will hand them one. Yeah.
Okay, very good. And last question before we turn to our colleague Travis at NAVYA. Question from Adam Halsley. What would you do differently? What improvements would you suggest to the approach that was taken in Shenzhen? So lots was done really well, as you noted, but if you could redo it, in hindsight is 2020, what would you advise other agencies, especially in those jurisdictions where the pandemic's just starting? What could be done better?
So hindsight 2020, we've always wished we acted quicker, even though I think the speed is already quite fast that we have reacted, but you're never truly prepared for a pandemic like this, especially in China's case. I don't think any of us was prepared to see the level of severity of transmission. So even though most of those cases were in Wuhan, but we were all very alarmed at sort of the speed of transmission. And I think the important thing here is you gotta have a plan in the beginning where we basically establish an emergency working group the last week of January. And then that group meets every day to sort of get updated on the situation on the ground, what are the latest pandemic info, etc., and to adjust our service line, adjust our plans accordingly. But we basically took people from technology, from route planning, from monitoring groups. So every department has to send someone who would be sort of the core task of that phase would be monitoring the situation and adjusting plans accordingly. And obviously, that needed support subsidies from, your local government, et cetera, whoever that owns the transport. And for us, we are a state-owned enterprise, but we are owned partially by the government, but also privately run by KMB, the Kowloon Motor Bus Company in Hong Kong. So it's sort of a joint venture between the government and here. So I think we both receive subsidies from local government, but then we also am dealing with these revenue losses at the same time.
That's fantastic, Haley. In fact, you answered another question that's hanging out there as to whether you got subsidies for emergency support as transit. And the answer is yes. And I think that's an issue hanging over the heads of a lot of transit. So thank you very much, Haley. We'll ask you to stay on the line because there is a plenary at the end of the workshop. It's possible to answer those questions. But if not, we'll make sure to collect up more questions for you and send them onward to you to see if we can answer them in another digital platform. Thank you so much for your time. With that, I'm going to turn to Jason to introduce our next speaker.
Sure, thank you. So our next speaker is Travis Ockerman. He's the marketing manager, North America for NAVYA. And for those who don't know, NAVYA is a French company, and they're a global leader in the research and manufacturing of smart autonomous vehicles. So over to you, Travis.
Yes, thank you, Jason, for the introduction. Hi, everybody. My name is Travis Ockerman. I'm the marketing manager at NAVYA, as Jason mentioned. I'm responsible for the oversight of all North American marketing and communications efforts for the autonomous vehicle manufacturer. Just wanted to first and foremost say that I'm happy to be here. Really appreciate the invitation, I should say, and all of your time in being part of this webinar. It's really, truly an honor to be part of this specific webinar in general, talking about autonomous vehicles in use in crisis. And so before we kind of get into the details, I'd like to discuss kind of what NAVYA is as a whole, as a company, who we are as an autonomous shuttle manufacturer. So if you want to head to the next slide, I can kind of give you all some information on who NAVYA is. And so NAVYA essentially, we're an autonomous vehicle manufacturer, I should say. We were founded in 2014, and we are a leading global name in the autonomous vehicle market. We sell autonomous shuttles that are designed for first and last mile transportation of both goods and people. And our shuttles have been sold about 160 times in 23 countries worldwide thus far. So as Jason previously mentioned, we are headquartered in Lyon, France, with a North American base here in Saline, Michigan. Between each base, we have about 280 employees. It's also worth noting that we have a subsidiary with Charlotte Manutention. They're an industry leader and basically one of the world's largest suppliers of airport ground support equipment. So just a side note that we had recently partnered up with Charlotte to manufacture the Autonom Tract AT135, which is an autonomous baggage tractor that was essentially the first autonomous baggage tractor used in real-time condition testing. So wanted to kind of talk about, who we partner with from an audience standpoint, and then transition into, the shuttles at a glance and kind of what they are. So kind of just, in terms of who we partner with as a manufacturer, we really do partner with a multitude of industries to improve the safety, flexibility, and connectivity of their transport offers. Those industries really do include everything from cities, forward-thinking communities, airports, campuses, theme parks, and hotels, to even private industrial sites and hotels. The last two of which I'll be discussing in a little bit more depth today, specifically the deployments at both Mayo Clinic recently in Jacksonville, Florida, as well as the Fukushima Daiichi nuclear reactor power plant, and how each aided in their own way in a response to a crisis. And so before I get to that, I want to share a little bit more about what the shuttle is for context, the shuttles used in these operations. So we're actually already on that slide right now, so I can kind of just get into those details. The shuttles used in these specific deployments were the Autonom shuttle, which is an 100% automated electric shuttle that seats up to 15 passengers. The shuttle does have about a 15.5 mile per hour maximum speed with a 9-hour average runtime. And essentially, due to the fluidity of its composition, no heavy infrastructure is really needed. So it creates a circumstance that has forward thinkers essentially wild with ideas at the thought of kind of the future of the shuttle and the element of V2X. But that's essentially a story for another webinar. So I want to get into the actual use cases themselves and how it directly applies to AV usage in times of crisis. And so if we move to the next slide, we can discuss the Mayo Clinic deployment. And so the first case that I'd really like to discuss in detail is the most recent, and that is the autonomous shuttle deployment at Mayo Clinic in Jacksonville, Florida. Now, this deployment was essentially the first of its kind in the United States in a partnership between our mobility service provider in the southern United States, BEEP, along with the Jacksonville Transportation Authority and the Mayo Clinic in Jacksonville, Florida. And this deployment was created to facilitate the safe transport of COVID-19 test samples and medical supplies on the hospital's campus from a drive-through testing facility from a drive-through testing site to a facility. And so the operation essentially was designed to aid when healthcare staff and resources are limited, and it provides a safe and controlled transport of potentially highly contagious COVID-19 test samples while working to reduce human interaction in the process to mitigate risk, which when quantified can really add up to a significant time saved that allows our healthcare workers to focus their expertise where it matters most. So now this deployment's also unique in that it's really an effective use case on private-public partnerships and that overall P3 element. And so the operation really was a perfect recipe of a public partner in Jacksonville Transportation Authority, private partners in Beep and Mayo Clinic coming together, with NAVYA Shuttle simply being the mechanism by which this entire deployment could occur. And so it really can't be overstated, though, that the vision for this deployment was conceptualized and executed by our partners at Beep and JTA and the teams at Mayo Clinic. And ultimately, it was their desire to provide a feasible solution in a time of crisis, using technology at their means that enabled this operation to successfully run as it has. Also coupled with each team's unbridled expertise and really sincere social consciousness. It's also worth noting that while no permits or waivers were needed due to the nature of this deployment being on closed roads, and the map you'll see on the following slide, so if we want to move to the next slide, the map that you'll see on this slide actually represents the closed course at Mayo Clinic. But it's also worth mentioning that governmental entities like NHTSA here in the US have been instrumental in pushing autonomous vehicles as really a means to help during this ongoing crisis by prioritizing things like petitions and waivers that address the current pandemic. So if we want to now head to the next slide, I'm sorry, we're on the next slide. I apologize about that. So what this represents is the closed course at Mayo Clinic. And a few notes on this specific deployment. So the deployment was launched on March 30th and remains running through May, so it's running today. It's an 0.8 mile round trip closed route. It utilizes up to 4 autonomous shuttles. When quantified, thus far the shuttles themselves have collected close to 8,400 test samples in just over 6 weeks. And so aside from the Mayo Clinic operation, the next thing that I'd like to discuss in a little bit more detail would be another relevant use case that our partners in Japan led at Fukushima Daiichi nuclear power plant. And so if we want to move on to the next slide, I can kind of get into the details on what that deployment looked like. And so as many of you are aware, in March 2011, a major earthquake did trigger a 15-meter tsunami in Fukushima, and it disabled the power supply and cooling units on multiple reactors at the Fukushima Daiichi nuclear power plant. The result really was a large-scale disaster that melted reactors within days and ultimately became the most severe nuclear accident since the Chernobyl disaster of 1986. So years later, our partners at SB Drive, TEPCO, and Mitsui & Company came together to partner with NAVYA and deploy 3 NAVYA autonomous shuttles designed to continue employee safety concerns and provide a flexible internal transport solution that more effectively managed employee transport during peak schedules as well as off-peak periods, but was built to adapt to the nuclear site's developments. And so the initial challenge of the deployment itself was to provide employees with efficient transport using autonomous shuttles built around the constraints of the world's largest nuclear power plant. And the results were an efficient transport service that was also an interest generator among visitors. The deployment also did provide a scalable solution that was indeed capable of adapting to deployments on site. And so if we want to head to the next slide now, we can talk a little bit more about Fukushima and the logistics. And so up until this point, it's been a 2-year operation at Fukushima. The route itself, while confidential, I can tell you is 3.5 miles long or 5.6 kilometers. It does operate on traffic on site and must deal with intersections. As mentioned, there are 3 autonomous shuttles currently operating a fixed schedule on the route. Now, for full transparency, I do like to mention that the shuttles at Fukushima do use a safety driver as a precautionary measure, which from a consumer level provides an increased level of safety due to the combination of controlled environment, speed, and functionality. So thus, it's really a repeatable and highly accurate service, and one that will never deviate from its path, the street it's programmed to operate on, or essentially its rules in general. So all in all, it's designed to provide an advanced level of safety working in a more controlled environment. And so while this particular case was an instance of response to continued employee concerns surrounding a crisis with lasting potential, it's an effective example of how autonomous shuttles do their part to increase accessibility based on need, which is an almost converse to the Mayo Clinic example, but a testament to how, regardless of need, an autonomous shuttle can adapt in the moments that matter, whether that be to create accessibility, like we've seen at Fukushima, or conversely, limit interaction and risk, much like we've seen at Mayo Clinic. So in these instances, the hypotheticals for aiding really do become endless. And so when we're talking about hypotheticals, I think it's important to think proactively in how AVs can help during future crises. And so based on our findings thus far, we believe that there are certainly opportunities to become more involved. And so, I feel that it can certainly be stated that autonomous vehicles have recently demonstrated a real promise in addressing some of these biggest challenges facing society amid public health crises of the sort. These examples really have led to a multitude of potential use cases for ways AVs can serve useful in future emergencies. And so examples of those would be, for example, the safe movement of hazard or fragile tests and medical supplies, like we've seen at Mayo Clinic, to even physically moving patients themselves are being used as mobile treatment or command centers in medical scenarios. Now, when we're talking about V2X, we can even start to discuss ideas like being more connected with hospitals from reading passenger vital signs and creating streamlined paths to getting better care for individuals in the moment. So when you can seamlessly connect with your environment, that proactive nature, those seconds that can add up to minutes, those could be the difference in saving someone's life. And so that really is where we are heading with this technology. And so on the smaller scale, though, autonomous vehicles are already being demonstrated and adding value in times of crisis in countries like China, much like we've already heard some of the great things that are taking place to aid in this ongoing crisis in the country. In some examples there that we've learned were autonomous vans being deployed to deliver food and medical supplies to hard-hit areas to compensate for labor shortages. And so this is kind of a similar parallel to what our partner Beat did recently using autonomous shuttles to actually deliver food and supplies to the Orlando Veterans Memorial Medical Center. And so, just one of those different use cases where an AV can sort of be repurposed in a situation, whether it's goods or people transport, to aid in the delivery or something, or creating more of an more accessibility in those moments again. And so really, in future outbreaks, we do anticipate AVs will provide a useful means for transporting passengers to facilities for healthcare, grocery stores, pharmacies, and even other essential places of the sort, while also ensuring sterilization and other filtration components are in order, essentially for us to adapt to this new normal world that we're living in. And so that's, obviously one thing that we have to take into account as a shuttle manufacturer. We have a 15 person shuttle, and with social distancing and sort of the apprehension in North America and how people, how the environment and people have adapted to the current circumstances, we also, as a company, have to be prepared to adapt to that as well, and develop processes and guidelines that will make people feel safe when they enter the shuttles. And that extends from the company down to the partners. And so, I think one of the other most valuable use cases for AVs in supplementing labor shortages in transportation is really in the sense that, we've seen amid mounting reports of drivers and delivery workers showing up sick as companies work to keep pace and adapt with skyrocketing delivery demand. And so in that instance, that's when autonomous vehicles start to look increasingly attractive as not only a way of keeping the public healthy and distanced, but also for addressing those critical labor shortages. And so, other than that, that's pretty much all I would have today. So I appreciate everyone's time, and would be happy to take any questions.
That's perfect and right on time. So Travis, we've got quite a few questions for you. The first off is some of the case studies that you showed, of course, really interesting use cases. And we have a question here about the fact that, and I'm going to pronounce the name Imtiaz Rahman, and I'm sorry, Imtiaz, if I've mispronounced your name, but is the use case and the actual use focused more on campus uses, and are there other scenarios off campuses? So if we look at the use cases you've presented, they are kind of closed loop cases, campus oriented. What's been the interest, and I'll add to that question, what's been the interest from open kind of transit applications, wider than a closed campus application? And if you can take us through that and some of the interest that perhaps transit has expressed to you.
Absolutely. So there is a sincere interest in using our technology outside of that sort of campus-based closed road environment. Now, being that we're based in North America, and in America, we do have different waivers. We have to work with NHTSA to ensure, that regulations are met when these vehicles are going to operate on roads. And so there's a lot of parameters and variables that we need to meet in order for a vehicle to successfully operate on a road, period. And so we do have some cases globally where our shuttles have been deployed on open roads, though currently in North America, that's not something that we can do at the moment.
Okay, and there's an additional question here about in general, and I'm going to pose this question, it was posed earlier, but it's quite apropos here, from Kaushan Wimalasari as a University of Calgary PhD student, asking about all these assumptions that we have going on about how transit could be proactively deployed. It really assumes that transit itself, like roads and train lines, are not affected by this specific emergency. And perhaps that might hold in a pandemic, but not in a tornado or an earthquake or a flood of the century. And so there's a query here about proactive measures to alleviate those types of risks. And if we situate it within your particular technology, the proactive measures that you can envision, driverless autonomous shuttles, enabling where the actual road infrastructure itself is hurt by the emergency. So getting to and from people or to and from facilities is damaged by the road infrastructure itself, and that might affect autonomous shuttles in particular.
Absolutely. In that instance, I think there's a couple of variables to account for. Would we be thinking of like physical damage to the road that would impede the actual route taking place, or would we be talking more maybe on the technical side that could impact like the V2X element and the shuttle's ability to communicate with its surroundings?
So the question was quite general, and therefore I'd say both. What if we thought about both? Because one would be, you know, potentially there's magnets in the road, or there's particular guidance in the pathway, or if it's fully autonomous, well, then maybe that it's not so hurt, but it is dependent on the connectivity of the system for navigating its network. So what if aspects of that system were actually broken down, then what's really the use case of these shuttles?
Absolutely. So, you know, in that instance, kind of to tackle both parts there, the first side of the equation is, and kind of, I would say my answer is going to cover both in a way, because, you know, our vehicle really is built with, you know, things like an onboard computer, many sensors who are able to perceive and model the environment around itself. So they really do communicate, I should say, the informations to the onboard computer, and it continuously consolidates and prioritizes perceived data in order to make optimal decisions. So this is like working in conjunction with the different sensors on the vehicle, things like, obviously, you know, if we're talking more about the specifics, LiDAR, the autometric sensor, and our inertial units, the GNSS antennas, all of these things come together to enable the vehicle to interact with its environment. Now, let's say if the road is impeded physically, that's what our sensors are for. And so that's essentially what our sensors are for, is to track that thing as we, track those impediments as we get to them. Now, on the other side of the equation, if a road is shut down and we have to determine another route, that's kind of where the V2X element comes in to communicate. Now we have deployment teams and commissioning teams that then take a look at alternate routes if need be, if the severity of it does require, a human to manually get involved and to make those adjustments. But other than that, the shuttle itself, really with the autonomy behind it and, the combination of those sensors, it's really designed to just hone in and interact and discover all of those things in real time to make those proactive changes in the moment.
Mm-hmm. And one could envision that these are much smaller shuttles, compared to a 40-foot bus. So they are more navigable and they're more malleable. And so if you had a disrupted bridge or a disrupted road, in theory, as you're saying, the sensors would allow it to navigate around that in a way that possibly a driver-focused 40-foot bus just wouldn't be able to. It's not as nimble and not as dynamic, couldn't make its way through the disruption, and possibly wouldn't have the sensors to enable the driver to make a maneuver to do so safely. So possibly looking at further discussions around that. And the last question we'll put to you in rapid fire, are folks looking at platooning automated vehicles with conventional buses and deploying them along traditional alignments and routes? In combination, I'll add to that with potentially redeployment off route for the sake of supporting emergency scenarios. So the platooning question with conventional buses when times are good, and potentially having the off-piste or the off-route deployment when times are not so good.
Yeah, absolutely. So I know that we have had discussions in the past with various agencies about the idea of the combination of autonomous versus traditional shuttles and using each, as the moment, depending on the ideal circumstance, right? And so that certainly is things that we can take a look at depending on the variables of obviously the deployment itself and what the site itself would look like. But yeah, those are conversations that do take place, and it is something that, in the future with kind of, this current crisis and how it's unfolding with social distancing, and the idea of maybe mass transit becoming a little less ideal than, your more, I would say, intimate, five person sort of shuttle, or even maybe just a, 1-2 person type of situation. So I think that, in the future, that is where we're heading. And from there, I think it's just a matter of more of an adoption for that use, and then determining more along the lines of the transport infrastructure between how, traditional shuttle is going to interact and work with autonomous shuttles in that circumstance, because there would be a lot of variables to account for that our deployment team would have to take a look at that are unfortunately a little bit above my head in terms of if that would be a feasible depending on the nature of the case.
Well, thanks so much. And that question came from Boris Kaganovich. So thanks very much, Boris, for that question. And thank you to you for the presentation and insight. I think with the dialogue we're going to be coming back to repetitively about the new face of transit in the future. And so with that, I'm going to turn to Jason to introduce our next speaker.
Yes, thank you. So our next speaker is Steve Young, Vice President of Technology and Innovation at VIA Metropolitan Transit, which is the transit agency for San Antonio. And I know that doing some research for putting together this webinar, VIA has really pioneered a lot of innovative ways to make sure the community is supported during this current pandemic. So Steve, over to you.
Thank you so much, Jason. Hope everyone can hear me fine. And we'll go on to the next slide, and I'll give you just a quick little introduction to who VIA is, because obviously there's some other VIAs out there, especially to our north, and want to make sure we're not confused. But we're a large transit agency in San Antonio, Texas area. We move about 38 million passengers a year. Our service area is larger than San Antonio. It's almost 1,200 square miles, so it's a very large service area. It's, as a lot of cities in especially the middle of the United States tend to spread out geographically quite large. And so that is a challenge for us down here. Not always known, but we're the 7th largest city in the US. We've been one of the fastest growing cities year over year for several years now. We're expected to add another 1 million people in the next 20 years or so to the 2.3 million we already have. So lots of challenges here. Although the current challenge was unexpected. Our fleet size, just for reference, not exactly a Shenzhen size, but nonetheless, we have a fixed route fleet, about 500 buses and over 200 vans. Actually, it was really interesting to hear about the electric buses in Shenzhen from Holly. We're actually in a major CNG conversion. A majority of our fleet has been converted over to natural gas. While not as clean as electric, it's much cleaner than diesel, and leverages in a highly available resource down here. So our employee base is about 2,200 staff. If we could go to the next slide, please. So just kind of a quick little description of what we did at the onset of COVID. I won't rehash. I would think a lot of what we did is probably very similar to what you heard on the Shenzhen presentation. But we did a couple things we really focused on at the outset of COVID. My team, which oversees all the transportation technology, bus technologies, as well as traditional IT, we really got a little bit of a jump start on this. We started kind of seeing what was coming down the road, and we started working to convert a lot of our teams at VIA, a lot of our office staff to work remotely. It was a pretty intense operation. The team did an incredible job to enable a remote workforce, and we're still largely, a lot of our teams are remote today, other than our crucial personnel for operations and maintenance. One of the things our agency committed early on was to try to keep all of our employees working and paid. Is that sustainable? Depending on how long this goes, we don't know. But it's something, it was a commitment we made, and I think that's pretty common across the industry. We also did a big focus, as we knew our service was impacted and our ridership was falling. And probably for comparison's sake, interesting, our ridership's only been down about 45% or so during the crisis. So it's a bit unusual. A lot of cities were much higher than that. But if you could actually just jump back one more slide, that's great. And then I'll get into that. Yeah, I was just going to mention though, our ridership, it wasn't down quite as much as others, but we still ended up with excess capacity in our staff. And so what we decided to do was really jumpstart a new initiative around online learning for our operations staff, which is something we had already done online learning with a lot of our office staff. And so we ramped that up in a very fast manner in about a week. to bring content for online learning to those teams. So we felt like if you're not going to be out on the street driving a vehicle, let's leverage this to build a better workforce. So that was something we jumped into really quickly. We also implemented an emergency, we had this in the planning, but we rapidly implemented a new emergency notification system so we could provide consistent communication to our frontline teams and our teams that weren't sitting at a computer. And of course, we had a lot of things we had to respond to with health concerns and mandates from the government. If we go to the next slide, I'll just give a quick one slide overview of kind of things we did operationally out on for service. We reduced our fixed route service to a lighter schedule. We did this at a couple of different times, a couple of different levels. We also, at one point, decided we were going to limit number of passengers on our buses to 16. And so, much like Holly mentioned, we had to put in spacer buses now and then to accommodate ridership. Because our ridership, we couldn't reduce our bus service too much with our ridership as high as it was. So we had to be a little careful around that. Our paratransit van service was down on a higher amount. And so that kind of lended itself an interesting thing for us. We had a lot more capacity left in our van service that was not being utilized. We did all kinds of cleaning protocols overnight at transit centers as buses had layovers. We had personal protective equipment, of course, for our drivers. We actually ended up, our maintenance team, their fleet team did a great job engineering essentially like a shower curtain by the fare box where passengers would come on board, because unfortunately a lot of our fleet did not support rear door boarding. We got rid of fares though to limit that interaction at the fare box. And so that's been a really interesting exercise. I don't know that it's altogether too different than a lot of agencies, but there was a lot of daily meetings, much like you heard before. We had a response team that's still meeting daily. You know, we're shifting more into the return to service discussions now and long-term operational response, but it's been a very interesting exercise. Next slide, please. And so kind of jumping in to really the heart of the presentation today, you know, we've always been at our heart at VIA about connecting people to jobs, to employment, to healthcare, to shopping, to education. And during this pandemic, we certainly maintained our core mission of connecting critical employees and people with services, with healthcare and groceries. That's not, you know, uniquely different to VIA, but it's something that we have a long history doing. One of the things, though, we really wanted to look at is how we could really better partner during this pandemic. We've been seen as a partner, but we're not always sure that everyone sees us that way. And so we felt like this was a time we really need to step up as a community partner and look at how we could help the needs of the community out there. And one of the things that really became apparent to us is that with our van service, the ridership being so low in our paratransit service via Trans, we decided let's focus on utilization of that group of vehicles and drivers. We did use a lot of drivers for things like cleaning, so we took a lot of that staff and then put them onto other tasks. But we decided to launch a long-term initiative branded as VIA Cares, and we have a logo. And part of that initiative then were the sub projects that we took on during this pandemic, and we found two needs that really stood out here in San Antonio. A huge hunger problem with the advent of the pandemic. Not to say there's not one normally, but the need was really vast. And the other big thing that really struck us here in San Antonio, we have a very high poverty rate amongst a good portion of our city compared to a lot of American cities. And that became a huge challenge as schools shut down, and they're still shut down through the end of the year. The learning for most of those students was shifted to online learning, and yet for those communities that lack internet access, that became a big problem. So that was something we decided to focus on as part of another larger city initiative around the digital divide. Next slide. So I'll talk about our first initiative, which is our VIA Cares partnership with the San Antonio Food Bank. Next slide, please. So this, I just threw a couple pictures in here. I really thought they spoke to how big the need was in San Antonio. So this, this slide is a picture from the San Antonio Express News. It's just been amazing. They've been having daily and weekly sets of food bank distributions of food. Next slide. And you'll see kind of a bit wider view of the same thing. This particular location had over 10,000 cars lined up waiting for food. I know that's a uniquely American problem that we line up with our vehicles, personal vehicles to get food, but the need was really, it was staggering. Next slide. And so this kind of brought us to think at NAVYA that maybe we could help with this problem. The food bank had a delivery service, volunteers that would deliver food, but the demand was just too great for the system they had set up. And so we decided to step in and work with them as they were trying to figure out solutions and ramping up these larger food distributions. And so we took on a project with them to leverage our paratransit Via Trans vans to deliver food to folks in need. And it's been a really well-received project and highly needed at the end of the day. Our city, we have several really large industries, you know, some of them not as affected by the pandemic and some highly affected. Things like military and some of our other technology related things have not been highly affected. We also have a giant tourism industry here, and essentially it's just shut down. And so just the amount of people all of a sudden forced, you know, furloughed, has been pretty staggering. I mean, even my wife's affected by that. And so it's really been an interesting exercise. And it's been really nice that our drivers have taken on a really purposeful mission to help those out in need and do it in a safe way while getting food to people. Because not everyone can drive up in a car to get food from the food bank. And so we set up these deliveries. We actually track all of this in our Trapeze Pass system so that we can document all the trips. If we're going to get funded for the trips, we have all of that data available. Next slide, please.
And Steve, we've got several questions coming in. So just to let you know, we've got 3 minutes left and then we'll turn to Q&A.
Okay, I'll speed through real quick then. All right, great. Next slide, please. So just, you know, quickly, we delivered about 2,500 boxes of food with this, highly successful. We'll keep moving on into the Wi-Fi project now. So we'll go a couple, it's at least 1 or 2 more slides. Yeah, so keep going here and we'll jump into the next one. All right, next slide, please. All right, so to address the digital divide, we decided to do a similar project, which I'll explain on the next slide. We decided that we would leverage the Wi-Fi capacity that we have on all of our vans. Next slide, please. And we leveraged a partnership with our San Antonio Housing Authority to bring vans into the neediest of their communities that housed over 3,000 students and park them on a rotating schedule to service those students with Wi-Fi access. And so we had to make some technology changes to our systems to accommodate this. But it's been a really nice project where students could access the Wi-Fi. We did not encourage them to cluster around the vehicles. The Wi-Fi signal went out 100 to 200 feet. And so largely they could sit inside their apartments or on stairwells or whatever, and or balconies and access the Wi-Fi. Really trying to address that digital divide gap here in San Antonio. Next slide, please. So, you know, we didn't see quite the numbers we hoped for with this, but nonetheless, we feel like it was a short-term success. We'll be ending the project on the 22nd of this month as school is winding down here in San Antonio. So we served with 20 vans, served 7 housing complexes with 3,000 students. Typically, we served about 75 a day, and we were able to count over 678 unique people serviced with this as of last week. Next slide, please. There's a couple quotes here. I won't go into them. Next slide, please. We did one spin-off project from this. We had a signing day for college athletics, and they had to shift to a streamed presentation here in Texas, and so we actually parked vans at 7 high schools as well, so that the students who had applied for athletic scholarships could tune into the stream. Next slide, please. And so that is the end.
That was a very rapid, we prodded you there, so sorry, Steve, for making you speak so quickly. If you can just go back one slide, Lana, we'll put it there. We've got a number of queries. So first question is, from a staff perspective, you had a lot of great images about staff being engaged and feeling part of the solution. Have you had any survey or feedback from your staff? Because we know transit riders under severe stress. We know depression is higher. We know that substance abuse is probably on the rise because of depression. So there's all these negative elements affecting transit on the front line, and yet this is a really positive initiative, these two sets of initiatives. What kind of feedback do you have from your drivers or your riders or rather your staffers?
Yeah, that's a great question. We have not done a formal survey yet to date. You know, the projects are still underway. Everything to date that I know of is anecdotal. When I've gone out and visited the sites and talked to the drivers, they've been very, we have a really good culture of service in our agency, and I think that's really carried on to this project from the drivers I've talked to. They really enjoyed getting out there in the community and feeling like they're helping out. And, you know, at the end of the day, this is a pretty low risk activity for them. So they're able to get out there and help and not feel at risk. You know, a lot of our fixed route fleet operators, they're still out there on the front lines. And much like most agencies, we've had operators who have come down with the coronavirus, and that's a really trying thing. And those people are putting their lives on the line every day. So no doubt there's a lot of needs to be addressed with those operators. But with these projects, I think it's been very well received.
Yeah, we'd be keen to know if you end up doing any surveys, what the feedback is, because it's definitely a mental health question in terms of keeping people up and going and giving them a reason to feel that they're part of the solution. And we know in literature, you know, when somebody dies in your family or the grieving process, you want to act. And this shows the system acting. So we'd be quite keen to see the results. And there's a question here from Misha Wanik-Libman, documenting, she says, it's great community support initiatives. Have there been discussions about if any of these initiatives will continue once demand for VIA services begin to return to normalcy? And I'll ask, if you don't mind, a rapid fire answer, because we've got a few other questions we want to get through.
Sure. Yeah, we've certainly considered that. We know we're going to have to scale back as we have to return to service, because ultimately our priority mission is the mission of transporting our customers. We are involved as an agencies on some of these projects. The digital divide is something we're partnered and in discussions with a larger group of people, because it's really a regional-wide or citywide problem. But it's a great question. I think we're going to be looking at how we can continue to do other projects, whether it's these or others down the stretch.
That's fantastic. And this one segues from the previous one from Dr. VK Gallat, asking, does VIA work as a demand responsive service in general? And what's the opportunity going forward, if I can add to that, for demand response for other elements? So there's this food bank drive, for example, and food delivery. What about medical services or not, you know, medical products? And people have talked about this in transit before, you know, transit using supplementary space as cargo delivery. Those dialogues have a history previous to COVID, but now innovation, well, you know, this pressure breeds innovation. So are there discussions here about demand response service overall and possibly other delivery types of services?
Well, we do have to work within the legal authority that we're given, right? So we have some federal rules in the United States about what we can do, what we can't do. But certainly it does raise some questions about, you know, are there some opportunities here? We already do have, beyond our paratransit, we have a VIA Link service, which is demand response through a mobile app today, and we're growing that as we speak. And we're going to continue to grow that. You know, we've even, you know, had internal discussions about, could you leverage your paratransit fleet at excess times, for instance, maybe evening demand responsive service, leveraging those same vehicles. So there's certainly opportunity there, and I think it's something we should all be considering.
Mm-hmm. And there's a dialogue we'd like to continue with you as well about creating new revenue streams for transit, which is a big dialogue everybody's having now. And if it is possible that this was doable, is it possible to sell or offer space on your vehicles for private service delivery? helping Amazon, for example, for good or for bad, but to make a buck for transit. And so those are the kinds of dialogues we'd like to be interested in engaging in going forward. So thank you so much, Steve. We've got a few other questions, but what we'll do is send them to you in written form. We'll try to post some written answers to folks online. With that, we're going to turn to, thank you again, we're going to turn to Jason to introduce our next speaker.
Yes, thank you. So our next speaker is Dr. Jack Rozdilsky, who is Associate Professor and Director of Graduate Programs in the Graduate Program of Disaster and Emergency Management at York University in Toronto, which doing some research, this is one of the leading graduate programs in disaster and management in North America. So Dr. Rozdilsky, over to you.
Yes, thank you, CUTRIC, for the invitation, and I'm pleased to address the topic. Before we begin, I think it's important to acknowledge that we have many people in our communities right now who are suffering or mourning those who have died from COVID-19, and at least here from the perspective of Ontario and Toronto, we are still in the middle of the event. I'm a professor of disaster and emergency management at York University. I'm currently involved in a number of social science research initiatives related to COVID-19. And I'm currently also doing some thinking about COVID-19 in relationship to public transit and some of the issues we are facing. My presentation has 4 points today. One point is to briefly speak to transit as critical infrastructure. The second point would be providing a few brief examples of how public transit assists during disasters and emergencies. Third, I'd like to raise an open question of public transit stigma. And fourth, I'd like to conclude with 5 targeted points. Next slide. Section 1, I'd like to speak specifically from the disaster and emergency management perspective and how we consider transit fitting into that. And the way we consider that is through the critical infrastructure linkage. Next slide. Public transit is an important element of critical infrastructure to preserve and keep operational during disasters. Even public health disasters we are seeing as extreme as COVID-19. Next slide. When we look at critical infrastructure is generally referred to processes, systems, facilities, technologies, networks, assets, and services essential to health, safety, and economic well-being. In Canada, this critical infrastructure is defined by 10 key sectors, of which transportation is one of those. Next slide. Under COVID-19, the Government of Canada has been providing very specific guidance concerning how to keep essential functions operational. And some of those essential guidance functions and essential services have taken on new meanings during COVID-19 over the past 6 weeks here in Canada. And it's been very interesting to look at how these essential services are being defined under COVID-19. Next slide. Specifically, public transit and its workers are being defined currently as essential services, meaning transportation workers in support of any type of emergency response, which is something we see taking place here in Ontario from a variety of perspectives. And also we have to consider the entire support and backstop infrastructure to support these transit networks, such as persons involved in maintenance, operations, dispatch, management, and administrative facilities. Next slide. For section 2 of my presentation, I would like to speak directly to some case examples of public transit's role in emergency management, specifically relating to hurricane evacuation, provision of temporary shelter, and prevention of terrorism. Now, these are 3 examples. There are many other examples that we can delve into that you will find in the literature Specifically, we can point to examples like the aftermath of September 11th and the maritime evacuations, but for the sake of brevity, I've chosen 3 illustrative examples for today's purpose. Next slide. My first example is coming from Hurricane Katrina, and this could also apply to many other hurricane evacuation situations we've seen in North America, where public transit assets are deployed for use during hurricane evacuation, hopefully in the best case to evacuate people before the storms strike in terms of preventative evacuations. Next slide. Now, we remember back to August 29, 2005, when Hurricane Katrina made landfall, and I was on the ground during Hurricane Katrina and its response and recovery, and it's a very long, complicated story with Katrina, as those audience members from Louisiana, Texas, and the Gulf Coast of the United States may remember, but our purpose here is to have a short, focused look at an aspect of Katrina. We remember Hurricane Katrina in part due to the failed response. In retrospect, public transit could have played an important role in advance of Hurricane Katrina's landfall by assisting in the pre-hurricane evacuations. There were an estimated 100 to 200,000 persons on the ground who were vulnerable residents who did not have access to private vehicles, but there was a failure in the execution of plans, which in some ways contributed to the situation of the failed response. Next slide. We remember from Katrina the pictures of buses that were flooded that could have been pre-deployed and used better for evacuations. We remember the helter-skelter temporary evacuations set up, calling buses from all over the central and Midwest and southern United States to head toward affected areas in Louisiana and Mississippi, evacuating persons to destinations ranging from Oklahoma City to Shreveport to Houston, San Antonio, etc. But what we do know is that public transit can play key roles during evacuation. Next slide. There were lessons learned from Katrina, including behavioral characteristics that affect the disaster response of transit agencies. And 3 I'd like to highlight would be the effectiveness of transit agencies in dealing with any type of disaster we found is related to the transit agency's experience with emergency incidents in transit use, cultural factors which influence how socially and economically public transit systems are used in terms of user adaptability, and also what we found to be very important factors of trust and credibility in the public transit system itself as an effective partner or an effective stakeholder in assisting emergency operation. Next slide. I had a few other slides in my presentation, and I do not believe the agenda item showing on the screen was one of them.
Oh, sorry about that. Over to you, Jack. It looks like potentially there was a chop off.
It looks like there was a chop off.
Yeah.
I could attempt to, I guess, continue verbally for maybe about 5 minutes.
That would help, actually. And so apologies for that. We'll try and sort out how we missed those slides somehow in the presentation. But you do have a few more minutes if you want to summarize the following lessons that you were going to articulate.
Yeah, I will summarize to the end in about 4 minutes and 30 seconds. The second point I was going to make was to be an example. And the example I wanted to depict would be an example showing how public transit was used in terms of a proactive asset that was deployed in the situation of an evacuation due to fire. In November 2019, we had a large building set on fire that created over 700, an evacuation situation with over 700 residents, where there was a need for immediate mass shelter. And what we saw in that example was buses used in this situation of a pre-active deployment as an asset to provide temporary rapid emergency shelter for persons who had to evacuate from a circumstance of a large building fire. That was the second example I was going to depict of how public transit could be used in the event to assist emergency managers and the management of crisis situations. Then, in conclusion, the last point that I wanted to make was to identify a problem. And this problem is identified as overcoming COVID-19 stigma concerning mass transit use. Currently, with public transit, one of the issues that we see emerging is that, at least from the observational perspective in Toronto, that TTC ridership has decreased by approximately 85%. Eventually, COVID-19 is going to diminish. We are going to be at a new normal. How are transit riders who are not using transit right now, who have a choice of modes of transit between transit and private vehicles, going to make decisions to re-inhabit public transit in the future? There is going to be a need to overcome the risk perception of a danger of COVID-19 infection from using public mass transportation. And that relates to stigma, where stigma could be defined as a mark of disgrace associated with a circumstance, quality, or person. We are finding that there are many stigmas associated with people and things emerging from COVID-19. I am a co-investigator on a Canadian Institute of Health research study, which is investigating stigma faced by Toronto's Chinese community. But what I would be suggesting right now, an open question facing us, is what do we do about COVID-19 stigma that is faced by public transit and how to overcome that? And I am suggesting that right now is the time that transit agencies need to be thinking about how do we identify, characterize, and then perhaps develop campaigns to overcome the stigma public transit may be facing, so that in the coming months we can have increased usership, so fare box revenues can help for the recovery of the public transit enterprise, as the sector is suffering greatly now. So in conclusion, my conclusion is 5 points. One, that we have a justification of public transit and emergency management's relationship through the common element of critical infrastructure. There are many examples that we can suggest for the use of public transit in relation to disaster and emergencies. Two highlighted: hurricane evacuation with Hurricane Katrina. Also, uses of buses for temporary, flexible, deployable assets that can be used in disaster situations. And my last point is that there is a problem that's emerging that has been identified of overcoming COVID-19 stigma concerning mass transit use. And with that, that is the conclusion of my prepared remarks. Thank you.
Thanks so much, Jack. And we've got a few questions for you. So we'll go through a bit of rapid fire with you to make sure we can get a couple of them in. Just starting off, first of all, in terms of public transit seeing itself as an evacuation effort, you noted in the Hurricane Katrina case, a lot of things could have been done better had it been planned for. And that wasn't the first hurricane, nor will it be the last. It certainly wasn't the first climate emergency, nor will it be the last. And as we've said, there's going to be loads of crises going forward. I mean, as I've said before, I'm 40 years old. I plan to live at least another 60 healthy years. There will be something that is pandemic, COVID-19 times 10, that is even worse. So within all of this, how do you get a sense that public transit sees itself as part of the evacuation effort? From driver's side, from a staff side, and from an organizational management side, what do you see there?
And well, what I see in that situation, when we look at Hurricane Katrina, there were plans in place, but the plans were not implemented. To answer your question directly, what we see with the relationship of public transit to emergency response capabilities. I think beyond establishing the initial stakeholder meetings to bring the groups together and make the plans need to be exercised, they need to be tested, and they need to be continually updated, because it's not a question of if, but the question is when the next disaster is going to happen. And the more proactive planning we can engage in for future events, the better off we will be able to have an integrated transit response. So even though we are in the midst of COVID-19, I think it's not too early to begin thinking about what is the next disaster. Is it the second wave of COVID-19, or is it flooding, or many of the other events that you have so, I guess, aptly presented in the introduction that we could potentially face?
That's fantastic. And one more question for you on a scale of 1 to 10, where 0 is we're doing terribly and 10 is we're fully planned and we have a kind of military style deployment of assets in the transit domain for critical crises. In Canada in particular, where do you think we are on that scale? And maybe if you can speak to the Toronto circumstance or the jurisdictions you're familiar with, that would be great.
No, and I'm aware of jurisdictions. I'm aware of there are many aspects of creative planning taking place and plans being put in place with men and women in both disaster and emergency management and transit cooperating. Now, that's one thing to do prior to the disaster. If I would put a number on it, I would put maybe a 6 or a 7 or an 8. Plans are in place, but then when we get into the boots on the ground, the actual response situation, there are many intended and unintended consequences that even the best of us cannot anticipate. So what I would suggest that perhaps COVID-19, even while it's happening, it's an important time to collect our lessons learned, to turn them around very quickly, because in conclusion, I'd like to say, with many disasters such as Hurricane Katrina, we have a beginning, a middle, and an end. And there are clear points in which public transit can insert itself to deal with the magnitude of the disaster. But during an extended COVID-19 type of crisis, I'm not sure if we know right now if we are at the end of the beginning or the beginning of the middle or somewhere in between. And that's even before we may be impacted by a second wave. So I think there's a need to both document, turn around, and get in practice lessons learned from such as the discussions in this event today, which are very important because we may need to put into practice much of this knowledge, unfortunately, sooner than later in relation to what we're experiencing with COVID-19. Over.
That's fantastic. Thanks so much, Jack. And we're looking forward to getting more information as we go ahead in the planning within Canada, but from a social innovation standpoint, seeing what the role of the federal and provincial governments are in helping municipalities really to future-proof. And as you saw in some of my introductory slides, I mean, Ebola led to planning about the transport of Canadians who have Ebola. And we have those plans, and ironically, BC launched those plans in January of this year. And so those plans are in place around how you transport people, on how you deal with people who find themselves in transport domains like transit. And it seems as though we do need to move a little bit faster in terms of learning from these lessons to future-proof for a possible second wave or a worse pandemic. So thank you very much, Jack. We really appreciate it. And with that, we're a bit ahead of schedule because we unduly chopped off a couple of your slides, for which we apologize profoundly. Our technical error on our end, and I take responsibility for that. We'll hopefully get those slides up and out to registered participants in the next little while. So over to you, Jason, to introduce our next speaker from the American Public Transportation Association.
Yes, and thanks again to Jack. So our next speaker is Pauline Hanson. She's the Senior Director, Security, Risk, and Emergency Management with the American Public Transportation Association. And really looking forward to this presentation. She has a couple of decades, if not more, of experience in risk management and in this sector. So Paulie, over to you.
Thank you and good day. And actually I have 40 years of experience in law enforcement, over 30 of that spent in transport policing, 27 of that with DC's WMATA, which I'm going to talk about, where I was the chief of police, and then 4 years with America's Railroad, Amtrak. And of course, APTA is the American Public Transportation Association. It's a non-profit international association of public and private sector member organizations. We do have representatives from all modes of public transport, bus, paratransit, light rail, commuter, high speed, and 90% of those who use public transport in the United States and Canada ride APTA member systems. So I'm really going to segue nicely on what Jack talked about. So maybe I can fill in the blanks with the lack of slides there. And I am going to start by talking about September 11th and the DC WMATA. And when people think about New York, arguably they think about the World Trade Center and the planes crashing there. But when you think about their subway system, their subway stopped running. They shut everything down. And at WMATA, there was a totally different response to that event. So, you know, the first plane crashed 11:30, sometime later you had the plane crash into the Pentagon. Actually, the police department had just gotten TV sets, mounted outside our offices. And I think sometimes we've moved so far since September 11th, we really forget the dynamics back then in relation to technology. So we actually had the TV on and live, saw the plane crash, and like everybody else really didn't understand what that was. And then when the second one did, we opened up our command center. And then certainly when we had activity at the Pentagon, that really influenced and impacted what happened with the transit system. So the local law enforcement chief, after he and the deputy chief there had seen that New York closed their system, called over to Metro and suggested that we close our system down. And we said, based on what intelligence? And they didn't really have any. And so we called, we had people on the FBI, a Joint Terrorism Task Force. We called a number of resources where we thought we could get intelligence. And there wasn't anything to indicate that that was something we should do. And, New York did it for the reason that they did it, but we didn't find a reason that we thought we should do it. So then our question was, who could shut us down? And WMATA is a very unique, it's one of two compact organizations in the United States that's created by a governmental state agreement. And actually WMATA was created by our Congress, and that creation was signed off by the President of the United States. So we found that only the President of the United States could shut down WMATA. So the general manager, I was the deputy chief at the time, the general manager and the chief went outside and saw the utter chaos. And our general manager, then Richard A. White, thought to himself, we were in the middle of rush hour. If we shut down, how do these people get home? So he made a very courageous decision to run, essentially what we did was run back-to-back rush hours. And you had transit workers who didn't have cell phones. People back then, you might've had a flip phone, but people didn't have the ability to tweet, text, or communicate. And so we had brave transit workers, much like we do today, taking people as far as they could get them, particularly with bus, into their communities to get them home without knowing what had happened to their own families or really what was going on in the world. And there were a number of things that had to be done when the last plane was in the air and before it crashed in Pennsylvania. We closed our over the river bridges. And then when the plane crashed, we opened those back up. We closed, obviously, the line that ran right underneath the Pentagon until we could get a structural engineer over there to make sure that it was structurally sound to run trains through. Obviously, the service didn't stop there. So I think that transit is such a vibrant, robust, important part of a community. And here WMATA showed its real value because it took the people that it brought to work, took them home, and anybody else that needed a ride. And when the President of the United States brought Congress together to give an unprecedented speech, there weren't the kind of barriers, physical barriers, Jersey barriers that we have now as a part of current contemporary architecture and design that's meant to protect buildings from vehicles that people would drive into them, to create a standoff. So there wasn't that type of security back then. And when the president was going to give a speech before the joint session of Congress, the Capitol Police called over and asked if WMATA would bring buses And there were buses that circled. The Capitol was noted by, Tom Brokaw as, he was reporting live. They had their helicopters up. And so I would suggest to you that that was one of WMATA's finest days, and it really showed how important it is to the community, much in the way it is now. Next slide. So here you have an event in, let's go back. I think we had Pulse Nightclub. Yes, okay. So you had Pulse Nightclub, which is in Orlando, Florida, and it was an act of terrorism. So you had somebody, go into a bar and shoot people up. So Transit's role there was in Florida, very hot at the time in June. Immediately, the local transit authority, which is called LYNX, brought buses for cooling for first responders. And it's going back to Jack's point, it's not because they thought that was a good idea, it's because they were integrated in the community and did do drills and exercises. And they did a number of other things. They transported equipment and supplies for emergency responders. The president came to visit, and they provided buses for that visit because they transported both families with the presidential visit. They transported families that flew in to the airport to go to the hospitals to see their loved ones who had been injured. They provided shuttle services for surgeons, going back to an earlier conversation about how vital sometimes transit is to first responders, and also helped transport other people to command centers. So a very small, bus-only agency, because they had drilled and exercised with local first responders, had that relationship, really showed on a variety of levels, from cooling to transporting to being involved in a presidential move, how vital they were to the community and how integrated they were in helping that community during an act of terrorism. Next slide. So now we're going to talk about civil unrest. So here, Charlotte, like many American cities, did have a police-involved shooting that had not gone well. There was a lot of activity between the transit agency and the local community when that happened to protect both transit employees, the riding public, and the transit infrastructure. So in this case, you had people that were not from Charlotte come down to demonstrate after you had a police-involved shooting. And so what Charlotte would tell you is that they were prepared for civil unrest, even though every event is different. And they had trained their employees. They did have emergency response plans that were reviewed on a regular basis. There was communication between leadership and operations during this event that was evolving. Charlotte, the transit agency, did go staff the Emergency Operations Center constantly 24 hours a day so that they would be able to alter their bus operations. Because as we know, even during something like civil unrest or the current pandemic, there are people who have to get to work. And in both the LYNX nightclub, the Pulse nightclub with the LYNX system, they constantly had their bus operations supervisors going out and posting up on bus stops that would not be serviced, in addition, obviously, to using social media. And you had the same thing here in Charlotte because it was an evolving situation. Facilities were damaged, bus stops and stations, but they were quickly cleaned and repaired and back in service the next day for operations. Their transit center got vandalized. It got overrun by demonstrators. Well, that got relocated because they had a continuity operations plan that required that, and they were familiar with where they would go if something like that ever happened. So you had leadership, you had drills and exercises, you had a continuity of operation plan, you had employees that had been trained, and obviously there were lessons learned, and that's another component of an event like this where you do an after-action report. Next slide. So Jack talked about hurricanes. Well, what I'm going to tell you is that Houston really did learn, and they learned from Rita. They'd had the Hurricane Rita, and maybe didn't perform as well as they would have liked. That was not the case with Hurricane Harvey. They have been recognized and acknowledged nationally for their response during Hurricane Harvey. They demonstrated how vital public transit was and the steps that you can take after a storm to look at your vulnerabilities, and which is what they did in Rita. You know, how they did this is once again, you know, a constant relationship with the local emergency management, staffing the emergency response center, or the emergency operations center, you know, whatever you call it. They had an extensive checklist of responsibilities during weather events, securing the vehicles, assuring that Metro employees that were on duty were cared for, provisioned for, and able to respond if needed. You had bus operators in Houston that had lost their homes, that were living in shelters, that were coming to work every day to operate buses because the storm went on, as we know, for days. Interestingly enough, previous storms that Houston had persuaded the Metro system to go and get military type transport vehicles that could go through water. And so unlike an unconventional bus, they could navigate high water. And one of the other things that they did during Harvey is they realized that the school buses had a higher clearance, and they actually went and got local school buses and started driving those instead of their own. The picture that I note here was before the storm hit, so a lot of people thought that they were crazy. They took their bus fleet and put it up on an elevated freeway. And the reason they did that is because obviously they had learned from previous storms where they lost a rolling stock because they didn't move it. And when they moved these buses, it was a sunny day, and people did question that wisdom. They lost very few of their rolling stock because of that. And some of the buses they lost because they were operational in the street that all of a sudden you had flash flooding. So, you know, one of the things that they did well was, once again, learn from previous experiences, go and procure something like this military vehicle that was a high water vehicle. You might only use it every once in a while, but when you did, you needed it. Because Houston has some of the largest medical facilities in the United States. And as was mentioned earlier, a lot of times first responders like that, doctors and nurses, they don't have vehicles, they take mass transit. So getting Houston back up and moving was very important to the city so that doctors and nurses and other medical care providers could get to the hospitals. So once again, some of the decisions they made on the fly, getting the buses from the local school system, school buses, because those can transverse water better. And once again, having a strong relationship with local first responders and staffing the emergency management center. They say they only had 12 buses out of their almost 1,300 fleet. And their light rail system operated until rising water caused them to close. So they're very proud of their performance, and it wasn't an accident in how that happened. Next slide, please. I'm going to talk about Maria in Puerto Rico. And the reason I'm going to talk about it is because we know that people from Puerto Rico were evacuated, and they were going to be evacuated to the United States. And I actually got a call from the Department of Transportation because they were working with FEMA to see where would be good cities to relocate people from Puerto Rico that needed medical transport, dialysis. And so what cities might be able to support a vulnerable population that was going to need medical services and the support of the transit agency, the use of paratransit vehicles. So they gave me 3 alternatives of cities that were potential evacuation sites. I called the director of the paratransit services at all 3, and Miami-Dade, which is a city that certainly has its own experiences with hurricanes. They, you know, you're supposed to have in the United States to be eligible for that kind of service, medical documentation, certifications. And so 2 of the 3 properties asked me, would the people have their medical certifications and documentation? I explained, no, they blew away or they floated in the water. The Miami system really showed its compassion, its empathy, and its ability to operate on the fly when they were asked, would they be able to support people that were going to be evacuated out of Puerto Rico who were going to be in need of vital life-supporting services. And they had a vision of how they could accomplish that. So the Department of Transportation, working with our Federal Emergency Management Association or agency, decided to go ahead and relocate that vulnerable population to Miami during Puerto Rico. So once again, an agency that wouldn't have had this in a plan. You know, nobody thinks about you're going to evacuate people from someplace else and they won't have their required certifications to be eligible for that service. But Miami was able to operate on the fly, obviously contact the appropriate people at our Federal Transit Administration and make this happen in a natural disaster. Next slide, please.
And Polly, we've got several questions lined up, so we've got about 3
well,
more.
You know what? I'm almost done. So how about
perfect?
We'll do. So here, most recently, you see May 1. Our CEO testified before a committee, and here you see the chairman of the Committee on Transportation and Infrastructure say this: public transit. Well, we've been saying this whole, hour, hour and a half, that it is an essential service. What it does during a crisis, but what it does every day. And so I think that we all realize, and what I have been saying during the pandemic event that we've been experiencing now for months, is that the medical folks, medical care providers are on the battlefield. It's the transit workers that are driving them to the front line, and they're dying doing it. And so to have this type of recognition about how important transit is to getting essential employees to work, I think is satisfying and an acknowledgement of everything we know. Next slide. So certainly here, I'm just going to give a couple of examples and of course, I think that, VIA did an incredible job serving their community, and people won't forget that. They just won't. And there are other stories just about, much like what they did in San Antonio, getting food out to the community. That idea to provide Wi-Fi to folks is just so compassionate and innovative. So here in San Diego, they found that 16,000 essential workers in their regional commute got to work every day by using the system in San Diego. Once again, underscoring the importance of transit during COVID. Next slide. And in Atlanta, what you did was you saw, here it's on the screen, they went to modify their bus routes, which a lot of other cities did, to better serve access to hospitals, urgent care, grocery stores. So instead of just running the traditional routes, they really focused, looking at the data from ridership, where they needed to have people. And then of course, like other agencies, use placards to create social distancing. And you have the customer hotline so that people could real-time report overcrowding, so that real-time service could be altered to ensure the safety of both the transit employees and the passengers. Next slide, please. So here's our Benjamin Franklin, and I think this says it all: by failing to prepare, you are preparing to fail. And really, that's all I have to say. And so I'm happy now to answer any questions.
That's fantastic. Polly, your expertise in policing as well as in the transit industry, I think, is unparalleled in terms of the depth of knowledge that you can bring with regards to case studies where and how transit has responded. So one of the first questions that came up was per what you were mentioning earlier on in your presentation about trying to figure out, well, who could tell WMATA how to shut down and when to shut down, and it came down to the president. There's a question here about, can you take us through the jurisdictional lessons learned? Is that effective? Are there any changes in terms of presidential control over transit? Is it more decentralized now? And one of the allied questions I'd pin to that is, in Canada, the discussion is that transit is run by the provinces. And so to tell a city what to do comes from provinces, not from the Prime Minister's office. Any lessons learned on your end from that experience?
And so, we're very different in America. WMATA is the only system like that because of the way it was constructed. There are only 2 systems in the United States that are compact organizations. And by that, I mean they were created by a compact. In the case of DC's WMATA, it's the 2 states in the District of Columbia had to have an agreement. And the other system is in St. Louis, and it's the 2 states, St. Louis and Illinois. That was created by a compact. But the bottom line is that, as you're saying in Canada, it's the province. There are jurisdictions who don't know. During the beginning of the coronavirus, APTA set up an email address where people could write in emails. And some people ask that question, and it's like, well, don't ask us who can shut you down. You really need to know that. And so that's a basic question that people's legal affairs or government affairs folks need to understand is, under a circumstance, who is it that can instruct you to shut down your service? In the United States, we know that there are a variety of levels of authority. And, so it starts locally with your mayor, your city council, and then we go to having a governor for our states. And so in some of our transit agencies, the governor is that, say all bus drivers will wear an N95. That didn't come from the mayor, that didn't come from the transit board or CEO, that came from the governor. He created the law that everybody has to obey. So because we're so decentralized by having a tremendous authority by a state and then by a city, I live in the Commonwealth of Virginia, which is the state. And, we're going to be released from the zero phase of the shutdown into phase one, this state, on Friday. But the part that I live in Northern Virginia, outside of DC, will not be allowed because the governmental representatives here lobbied the governor and said they did not think we were ready because we, haven't flattened the curve. So American authority is a very unique, kind of complicated and messy, but who can shut you down is a pretty important thing to realize, because you may want to run and then other people want to shut you down for a variety of reasons, depending on, are you having a riot? Is it because they think you're unsafe because of a pandemic, a virus, or any other kind of, fire, natural disaster circumstance? I hope that answered the question.
Yeah, for sure. And the counterfactual holds as well. Who can force you to ramp up, right, in a scenario? So you can be told to shut down, and who can force you to deliver services and then force labor back to the front, whether people feel safe or not. And that is certainly a dialogue happening in Canada and the US. But, to put it bluntly and ask for your rapid fire feedback here, the division politically in Canada between left and right is minuscule compared to the United States in terms of public health, public service, and partisanship. I think most people would agree with that. There's very few issues around public health and public service where we divide so radically. Given the scenario in the US and what we're seeing in terms of return to work, governors opening economies, presidencies having differing opinions from governors that are fundamental about safety, what do you think the big issue is for transit in the current pandemic and immediate post-pandemic world? From a political perspective, what are we going to see the transit agencies doing proactively or reactively, given the politics of the landscape they live in?
Okay, so everybody's focusing on the future now. And so the majority of states in the United States have embarked on a path of opening up, whatever that means to them. And I gave the example of where I am. It's very confusing here because you got a mayor that's doing one thing, the governor in Virginia doing something else, and the governor in Maryland. And the metropolitan region in DC is, it's not divided by those state lines. It's a cohesive unit. So to the extent that they they have tried to agree, and it has had nothing to do with party lines there. I think many governors, what happens in our Congress is not what happens at the state level. I think that the governors who run our states are far more bipartisan with local representatives and mayors. Because they have to. And, but, kind of going back to your point, I think the majority of people are focused on restoration and recovery. And what does that look like? And I think we know it several things. One is, what's the new mobility paradigm? Because a lot of people, you just heard Twitter say, don't ever come back to work. You don't ever have to come back into an office space. So that is going to change who uses our service. I think the whole commentary on social distancing now is encouraging workplaces to really stagger the work hours. So where we had the morning peak and the afternoon peak, people would like not to see peaks like that. They'd like to see an even flow of people coming through the course of the day. So I think we'll see those people who do go into a workplace, their hours really altered. I think that at the end of the day for transit, it is who says how clean is. Kind of going back to who shuts you down, and so, or who ramps you back up. So who is the definitive authority that says, yes, you are clean? Because I know from the calls I'm on with European colleagues, some of them are just going to use soap and water, encourage people not to wear masks, not require them. And we have various levels of that in the United States. Systems requiring people to wear masks, but they'll give you one, enforcing it strictly with law enforcement and other transit employees. So I think that opening back up is going to be a challenge because mass transit and social distancing, you know, don't connect in many ways. They may have during, you know, the several months where people have been shut down, because it's essentially been a small body of essential workers going to work. But I think how clean, who says how clean it is, and our ability to be nimble, going back to what Marta was doing, which is having real-time reporting information about ridership. Because ideally, as trains come in, you'd like to be able to tell people what cars aren't full of people. And actually, you know, Chile's new subway system has that. So as the train comes in, you see a screen and it tells you, you know, red, yellow, green, so you would know what cars to go on to. So we're going to have to get back confidence of people who, rightly or wrongly, you know, think that they would be more exposed in a transit environment, which may not in fact be true. But who is it from the medical community or our centers of disease control or the World Health Organization that will explain that transit is safe and that people are free and secure to come back and use that service as they return to work? Because in the United States, I know in many of our large urban areas where people are most dependent on transportation, people aren't going to be able to drive their cars in. There aren't enough parking spaces. Traffic would be horrific. So how do we communicate that we are safe and ready and using real-time data to make people safe, because we'll be able to make service decisions on ramping it up, spreading it out to create that safe distance between passengers.
That's fantastic. Yeah, definitely a fantastic deep dive overview, Polly. And, you know, our position, certainly my position, is this may be the motivator. We need to invest way more in transit. And why did we ever accept crush capacity to start with? How about we allow a more luxurious service for the transit rider? Maybe we need to duplicate and triplicate the number of buses out there to allow social distancing and a better ride for the client. So there's lots of things that could come out of this that don't need to be reactive, but proactive towards just a better system overall.
Well, and I think fare media too. So I think you'll see people going to the kind of fare systems they long knew they needed to do, where, you know, I have, because, you know, we don't want to touch anything now. So I think you'll see those kind of innovative conversations where there are less touch points, and certainly, you know, whatever innovations come out of the conversations about HVAC and cleaning solutions, and cleaning that's already built into, you know, an escalator railing, or not having to push buttons in an elevator. But thank you for the opportunity to present today.
Yeah, well, thank you so much, Polly. And with that, we're going to segue over to our next and final presentation for this workshop today. And this is actually a great segue because it talks about how do we make the system more future-proofed, how do we deploy the system not only in the circumstance of pandemic, but maybe even make it better overall as a result of all these lessons learned. So Jason, to you to introduce our final speakers for the workshop.
Yes, thank you. So we have a co-presentation. We have Cathy Campbell-Wilson, Vice President, Rail Transit Solutions, and Mike Palmer, Director, Rail Operations and Communications-Based Train Control, and they're from Parsons Corporation. So Cathy and Mike, over to you.
Good afternoon, and thank you for your willingness to consider the topics that CUTRIC has put forward today. Mike and I both work for Parsons, and we've spent our careers in service either publicly or privately in transit and transit operations planning. So this is a summary of the topics we'll cover. Next slide, please. When Josip and I first spoke about the pandemic and its effects on our transit systems and communities, and about how to prepare for the next wave, it really reminded me of the number of times Mike and I have been involved in a control center project, whether it be an integrated or backup or emergency center, where it was contemplated to have remote access, but the design wasn't implemented. And there's been many reasons for that, specifically security, IT infrastructure, and policy. But it's worth noting that our preparedness efforts over the past 10 years have been focused mainly on physical preparedness and disaster preparation and its effects on control centers. So Mike and I have been talking recently, and our conversations have centered around what we call the never normal again and the nature of the transmission during this pandemic and what that may mean for developing a total solution for command and control. So Mike's going to walk you through some ideas. We hope that they'll stimulate further ideas as the technology does exist right now for virtual operation and management. And we'd like to talk about how we consider how that can be implemented on our various networks, rail, bus, and road, to a broad variety of agencies with variable needs. So next slide, and over to you, Mike.
Thanks, Cathy. I'm glad we're going last on this on this meeting, because what everybody has to take away is, what do we do next? There's no point in listening to all of this if you do nothing afterwards, because then you're no further forward. When we talk about emergency preparedness, I will let you read the slide yourself. I want to pick out a couple in particular. Emergency preparedness is akin to an insurance policy in the sense how much time, cost, and the degree of quality that your agency puts in is how well it will pay off. So if you pay it lip service, you do it quickly and it's cheap, it's unlikely to have a benefit. And so there is often a value on the benefit you get out by the number of dollars and the amount of time you put into it. And also it's ongoing. You can't just have a splurge now and be operationally ready in emergency preparedness. You have to continue with ongoing training and refreshing and updating the software and so on. And therefore, I do think its commitment is only as good as your commitment and having it for a practical use and an actual benefit. Two other things I would say about emergency preparedness: it often falls away and gathers dust. So at the end of this pandemic, we're going to go, great. And we're going to take our eye off the ball. And when the next one comes, we're going to go, ooh, and you can see governments all around the world who've wasted weeks and months and years of not preparing for their own plans. And also it has to have some credibility, longevity, with practical advice and solutions. It has to work. Next slide, please. Before we just choose move on to, are you being prepared? I resonate with what Polly said around, you know, I was in London 7/7 and the bombs went off. I worked for London Underground and we wrote rest of the service day off, but we had to be ready for the next day. But nowhere in any of our plans were suicide bombers across the bus and rail network actually featured. So here's a list of things for you being virtually prepared. So what we're talking about really comes on in the next slide, but you need to think in your traffic management center, in your control center, your OCC, whatever you call it, these kind of tick box things, thinking about the mindset and willingness of the team, tech designs and architecture, hardware and equipment, your software, your data comms, how you store your comms and archive it, security and risk mitigations, and we'll touch on that shortly, your own policies and procedures, people training, and how you manage change management in the organization, your resources, your timelines, and previous implementation experience. After every real event, every exercise, you should be learning from it and rebuilding it into your next plans to make sure that you've learned your lessons and you're not criticized in the same way some of the governments around the world are at the moment. Next slide, please. So understanding the challenge, transportation management centers are buildings where operators gather to use various equipments and systems to monitor and manage transit. Hundreds of these TMCs are present across North America and in Canada. Often at the moment, your operators and staff in control centers are in close proximity, they often share the same desks, share the same equipment and facilities around the clock, whether that's bathrooms, locker rooms, elevators, and so on. And I think what this pandemic has taught us is just how much we expose ourselves to other people's germs, even in control centers now, touching the same keyboard and mouse, and how unhygienic perhaps we are in the workplace because we just took hygiene for granted. Some operators have the ability to move to remote operations, but a lot of these backup centers, these standby centers, these secondary control centers only have limited functionality or performance. The only true transportation management center in the world I know of is the Channel Tunnel between the UK and France. There are 2 control centres, one in the UK, one in France. They're staffed 24 hours with identical functionality. And because the trains are tracked under a sea that's 26 miles wide, underwater, either can operate it. And so the chances of you evacuating one in France and one in the UK at the same time are pretty remote. And that's the level they've gone to there. Some of your challenges for virtual TMCs will not be the obvious stuff. On the easier side, I would put cloud-based solutions for non-vital signaling control, because you still have the vital equipment on the ground. So you need to determine what's vital, what's non-vital, and think about the things that are going to catch you out left field. Moving to a new virtual centre doesn't solve this problem, because the pandemic is going to take people out. What's going to stop you is, and you can see it in London and you see it in Toronto, is a lack of bus drivers, or a lack of subway drivers, or a lack of control centre staff. So if you create a new centre and move everybody there, you've just moved a problem 500 miles west or whatever. So what you have to do is to spread the risk, not just move to another location. And to do that, you create clusters. You create a series of control centres, small groups, individual people who can operate your centre. So CMRail recently did a trial weekend where a couple of their dispatchers signalled the CMRail freight network from their home using laptops and equipment. And that was just a toe in the water to see how viable it was. The signalling was less of an issue. The communications was a big issue. Secure cab radio, all the telephony, talking to your colleagues around North America. The other thing which I thought was good, Calgary reopened their emergency control centre and split the control room staff into two groups. So if either group went down, the other group could carry on. And that was specifically to deal with losing people rather than losing assets. Next slide, please. This is a virtual transportation management centre. There's a definition at the top, and that's in association with the Department of Transport document, which has been prepared on it. This talks about the functionality. The bit I'd like to draw your attention to is the bottom left-hand side. So what we're really talking about today are virtual centralised TMCs and virtual distributed TMCs as well. The most important thing on that whole slide for a virtual TMC to work is what do I really need versus what's nice to have. So in the mid-80s, when I was a tower controller for London Underground in my early 20s, we had almost no CCTV. And yet now CCTV is everywhere and every agency is fixated by CCTV. But if you switched it off, you can still run your trains and your buses. You just have less information to go on. And so it's that sifting of what's really important and what we need and what's nice to have in 2020 during the pandemic. Next slide, please. This is just a quick graphic to show you the difference between yesterday and today. Lots of screens, lots of mouses, lots of monitors, lots of paper. And the reality is the new control centres are like the one on your right there, with one big screen and a very tidy desk and this ability to move stuff around via various IT systems. Next slide. So relevant standards. As we move to virtual transportation management centres, and I think we will, you cannot just throw away the rule book. You can't disregard the US Department of Transport Virtual TMC Guidebook or NFPA 130 or alarm systems standards or ergonomics of your virtual TMCs. You have got to consider your SIL levels and what really is SIL for and what's lower, and also look at best industry practice. Copy from others that are getting it right. You have to consider your own health and safety legislation for your city, your province, your state, your country. Importantly, you must apply diversity and disability lens to all of what you do. So in Ontario here, the AODA regs, employees who have to care for elderly people or for children. If you go to virtual TMCs, are you helping or hindering them? Because you have to look after your workforce in that sense. And also simple things like display regs as well. Next slide, please. Virtual TMC ConOps. This is just to remind you that ideally, if you're going to move to a virtual transportation management center, you must have a concept of how that's going to work. And so you should all have operational concepts now for your bus, for your light rail, for your taxi, for your Wheel-Trans, for your subway services, that talks about normal, abnormal, degraded, and emergency. The VMC's got to have a similar one, talking about how in a normal day you would operate it, even though you're in an emergency scenario, abnormal, degraded, and what happened when you're in, in your clusters and you then have an emergency. How do you deal with a 9/11 or a 7/7 or a Katrina when you're distributed around the place? Next slide, please. I'm going to skip through these. These will be in the deck that you get, but this is what a virtual TMC model can look like, from your data centers through the cloud to the stuff out in the field, but also going down to the operators. And the next slide, please. You can do hybrid models as well, where you can take different means of communicating. Ultimately, it's the same field devices, and it's a different mechanism of getting stuff into the servers. And then again, if you look at the bottom, how your virtual TMC operators, wherever they are, can still operate. Next slide, please.
And we've got a few questions, Mike, so we're just down to last 3 minutes.
Okay, that's good. Two big questions that people ask. One is about security. And so we've put a slide up here to you to think about the security of your system in a virtual TMC. Next slide. The big question everyone asks is cybersecurity. And so here we're showing how we currently use firewalls. And on the right, I've taken a company's new system and how they are managing to deal with all of these 7 strategies to defend it, against cyber attacks. Next slide, please. So getting ahead of the curve. The only thing I want to bring out on this slide is the bottom 3 points. You have to be ready to transition when needed at short notice. There's no point in having these plans if you do nothing about it in the short term. So what is your timeline from when the firing pistol is shot to you being able to staff that center? Is it 12 hours? Is it 12 days? Is it a month? Because if it's going to take you 2 months to mobilize, you may be too late. The UK and Singapore is interesting. Singapore had a pandemic plan and it worked really, really well. The UK had a pandemic plan and it didn't work well, and it was the same plan. Singapore copied the UK's plan because it was seen as best in class, but the UK failed to follow its own plan. And that's why the UK is one of the hotspots in the world. Singapore followed this good plan well, and that's why Singapore is in a much better state coming out of the crisis now. One more slide from me, and then I'm handing back to Cathy to close, Josepa. Actually, Cathy, do you want to take over from here?
Sure, thanks, Mike. We'll try and go quickly, Josepa. So in terms of addressing the long-term requirements, this is data and a list of information that agencies should already have, but maybe not in a collective manner. So this could be a tabletop exercise that could be done now in terms of planning. As Mike said, we don't need to wait. Next slide, please. This is a series or a list of our lessons learned from control center management, design and operation, and a list of the requirements that we think are important to create a baseline for a virtual operation. This does require more effort from an agency and outside industry outreach. Next slide. Hopefully we can share all of this when we're done for those that have been on here. This is our roadmap of what we view as a path forward to a virtual control center and the steps that need to be taken to upgrade or to implement one. And this was derived from some of our experience with DOTs in the US as well as rail operators. There are some DOTs of the US that are currently operating virtually without a bricks and mortar location. Next slide, please. The last slide, I think, is just questions. So hopefully we're right on track.
Well, thanks so much for whipping through that last set of information. We will send out the deck so people can read through it a little bit more in detail, but there's a lot of information packed in there. So first question is actually apropos of something, Mike, you mentioned. If we're thinking about decentralized, distributed control and management centers, is there a role here for blockchain? Is this the underlying technology? What's the underlying technology that enables these communications in a cyber secure dynamic mechanism?
I think there's several parts to that question. Is it possible for you to go back to slide 6 for me, or is that too hard on the deck?
Possible to do. Give us
I think it depends on the systems you're deploying. I don't think any two agencies are going to have the same solution. It has to be localized to your environment and your requirements. Slide 6, if we put it up, I deliberately included a garage converted. You know, the freight company used people in their living rooms, in a spare bedroom, in their office at home, accessing the network. And what I put up on slide 6 was just a few ideas. So one is converting a person's garage into a mini control center. It's the one with 3 images on the right-hand side, slide 6. The other thing that we're exploring is a series of containers, freight containers, where you could convert a series of containers to virtual control centers, and you could ship them around Canada by train or road and either drop them on land or in a person's drive, which hold 1 or 2 people who could work from home. That's for one. And then the third one is, if you're really serious and it was worse than COVID, why wouldn't you go to a hotel in a different province or state, 500 miles away, 1,000 miles away, take over the wedding reception ballroom, turn it into a virtual control center, take 12 or 14 rooms in a hotel, and have your staff self-isolate there. You know, if you're talking about these essential services, moving freight, moving people, all the things that transit and bus services in Wuhan are saving people's life and making life easy for the city, you've got to be innovative. And so just moving it to another office of your own is not innovative. You're just shifting the risk sideways. And you have to discern between vital and non-vital technology. So the vital technology on the ground to stop trains crashing is not touched. Everything we're talking about is voice, it's data, it's via cloud, which has its own security. And so you then start applying the levels to that.
So then last question we'll turn to in rapid fire. What is stopping transit agencies from implementing these plans right now? And one of the dialogues I had with Cathy as we were thinking through this is there are a number of transit agencies that thought proactively to do this, and then it got prepared and it's in a report and it's on a shelf and it never got implemented. So is it politics? Is it money? Is it inertia culturally in terms of how things have been done before? So if you can take us through what's just stopping this from already existing.
So very crudely, that is what's stopping it in the main. And I think the other thing that's stopping it in the main is time. And so no agency's got the money to do this. This is your insurance policy. How much do you want to invest now for a payoff in a year's time? You know, 4 months ago, I was planning my vacations this year. I now have none. I cancelled my trip to Europe in March. And I think none of us could have envisaged this 4 months ago. Had we done so, we'd be in a much better state. And you can see the hotspots around the world who ignored early action and are now paying the price. And when you look at New Zealand, who were a model of excellence and are the first out the other side. And so I think companies have to find the time, they have to find the money, they have to think outside. If you're going to create clusters, find the staff who are willing to do that, find the locations where you would do that, identify the technology that you want to use, and then you need help putting it together. And what you want is very different to somebody else. But there's so much people should be doing today and tomorrow, not next month and not next year.
So Mike, thanks so much for that. And we'll wrap up on that point and we'll head to our concluding slides. And just to note as a segue from what you noted, I think it's a fairly standard point at CUTRIC that really it's not only the pandemic that has caused this thinking. I mean, climate catastrophe has been around for years, decades. And so if we take pandemic out of the equation, repose the question to you, Mike and Cathy, you know, what's stopping agencies from doing this, given that the 100-year flood and the 100-year tornado and the 100-year climate event is happening now regularly, and every climate model out there is showing us that floods and disruption are going to happen. There are other reasons why distributed virtual control rooms are an appropriate solution. So it's hard to say, you know, nobody thought about it 4 months ago. Well, I mean, people have been encouraged to think about this as a climate mitigation strategy for several years. So we have a bigger issue at CUTRIC to figure out how do we encourage climate planning and disaster planning to become a core part of the overall transit investment planning by all levels of government. So if there's any concluding comments you want to make there, Mike, and then we'll turn to our last slide on the conference.
I think agencies and people in agencies who have a decision making, and with commissions and for the local cities and so on. How many people listening to this have bought travel insurance and not used it? And the answer is probably all of us. And it's around peace of mind. But the one time your insurance is used, you're really glad you invested the money. And part of the problem for agencies is quantifying the benefit of emergency planning and something like this versus the cost.
Yeah, that's fantastic. And it is that hard, difficult risk assessment of the unknown of the future. And to conclude on that, we have an attendee who has posted here as an FYI to everybody. Just consider this: the TRB's National Cooperative Highway Research Program, NCHRP, has report 769 called A Guide for Public Transportation Pandemic Planning and Response, dated 2014. And so that's just a good indication 6 years later. It is that risk assessment of the hypothetical and theoretical, combined with the cost now, as Polly mentioned, all the folks looking oddly at the agency that elevated its buses on a sunny day, and the assets and the costs associated with that, given the risk assessment they were engaging in. So thank you very much to everybody who's been a panelist on this workshop. We know, per usual at CUTRIC, we skipped the health break to make sure we could catch up on time, and so we apologize for that, but we've had excellent participation from our attendees throughout the entire event. With that, Lon, I'll ask you to go to the last slide just on the conference, and we'll just remind folks that if you haven't registered already, our conference in June, we chose to virtualize right away as an innovation consortium. We refused to shut it down or cancel it. These are important dialogues, and we will be having another COVID-19 transit innovation planning panel at that conference. Jason will be working with some of the panelists here today, as well as new content to build that out. From this time today to the middle of June, there will be additional ideas about how transit needs to design itself, redesign itself, and probably get money from governments in order to prepare and deliver on exactly those hypothetical risk assessments Mike, you identified, and Jack, you identified, and Polly referred to as critical to our ability to future-proof transit for the 21st century. There is no doubt to conclude that transit should not look the way it's looked in the past. It needs to look more robust, more dynamic, more flexible, better funded, more luxurious, more frequent. All of those things have to happen in the 21st century, not just because of pandemic, but because the climate demands it. And so do transit riders, frankly, one of which is myself, and most of which include our team here at CUTRIC. So thank you very much to everybody who's participated. Thank you to folks who are on the line. If you do have any final queries, feel free to send them our way. And we know that we didn't get to all questions, and so therefore we will ask our presenters to answer in written form. And so if your question was not answered, it will probably be answered in written form, and we'll post it to our YouTube channel when this video goes up online. Thank you very much, everyone, for the time that you've taken today, and I hope you have a safe period ahead, and we hope all together that the economy recovers and transit takes off again. Take care.